Mr. Benjamin.
All right, so I'm about to start the program. I'll be doing a little bit of talking points before I bring in my guest. Okay. All right, so welcome to this edition of the Sankofa African Review. My name is Benjamin Akwe. Sankofa African Review is actually organized by Bell & Associate Consulting Limited. I'm your host for today. My name, again, like I said, is Benjamin Akwe. I'm the director of research at the Sankofa African Review. For those of you joining us for the first time, Sankofa African Reviews webinars, we do host webinars and interviews, right? Interviews are just one-on-one, and webinars is when we bring panel to come and have discussions. So for those joining us for the first time, Sankofa African Review serves as a bridge between those in the diaspora. We have Africans who are in the diaspora and Africans who are also on the continent. So we are using the Sankofa African Review as some sort of bridge, right, to educate and to inform. So it's more or less like a virtual panel discussion where we bring experts across the African continent and the diaspora to discuss contemporary and regional issues on the African continent and how to find lasting solutions to some of the problems that we have. Because those on the African continent have a different perspective, and those also in the diaspora also have a different perspective. But how do we bridge that perspective? Since the diaspora has been declared as the fifth region of the African continent, currently there are 5 regions of the African continent: the northern part, the western part, the central, the eastern, and the southern part. So we have 5 regions on the African continent, but the AU has declared the diaspora as a 6th unit or the 6th region. So how do we bridge that gap between those on the continent, the 5 on the continent and the 1 in the diaspora? Right. So today's discussion topic is negotiating and mediating Ghana Registered Nurses and Midwifery Association condition of service and strike action. In whose interest and at what cost? When I'm asking the question in whose interest, the strike that they had, whose interest was it in and at what cost? All right. So it's rather unfortunate for us at Sankofa African Review to be discussing the topic at this point, given the loss of lives resulting from the impasse between the leadership of the Ghana Registered Nurses Association. Okay, I said, please turn off your microphone, please. Right? Give me a second. Let me try to turn some people's microphone, then we can continue, okay? So I'm saying that it's rather unfortunate that we're having this discussion at this point, right? Given the loss of lives that has occurred during the impasse between the leadership of the Ghana Registered Nurses and Midwifery Association and President John Mahama's administration. Like I said, I'm using the word administration instead of using the word government. Right. So we take this opportunity to console with the families of those who lost their lives, who lost their loved ones, and let them know that our thoughts are with them. May their souls rest in perfect peace and their memories be a blessing. The discussion today forms part of Sankofa African Review discussions on Ghana health sector, Ghana healthcare sector. The first of Sankofa African Review discussion was on February 28, 2025, on the topic of President Mahama's State of the Nation's address and the controversies surrounding the Agenda 111 with our special guest, Dr. Anthony Isiasari. We hope such open and objective discussions and stakeholder engagement on Ghana health sector will lead to African-centered policy reforms and solutions to our country. Now, to our listeners and viewers on the various social media platforms around the world, the Sankofa African Review are anchored on a myriad of perspectives. So there may be differences in opinions from our guests, but these differences in opinions from our guests does not mean that opinions or perspectives shared are right or wrong. It only reveals that there are what differences, and we have to learn to accept that. Okay, like I said earlier on, those of you who are joining, just mute your microphone. I'm still getting feedback, all right? So like I said, there may be differences in opinions from our guests. It does not mean that one person is wrong or one person is right. It just shows a divergence of perspectives, right? Now let's continue. Now the Sankofa African Review also relies on what we call narratives for our discussions. Narratives, as we know, are an integral part of what African societies. And in our discussion, we utilize them based on research findings, based on policy positions, based on realities prevailing in various African countries. The narratives help our panelists. The narratives help our panelists to be able to make independent to share their independent perspectives, which sometimes may not align with whichever organization that they are representing. So, but sometimes when we are people coming from government, we ask them to speak on record. So at some point in time, some of those who are coming from government, I'll ask them to speak on record. Okay, for the last time, those of you who have joined us, I've told you mute your microphones. If you don't do that, I think you give me no option than to get rid of you. So just mute your microphone as a courtesy for us to continue with the program. All right, thank you very much. Right. So today we have experts and practitioners from the healthcare sector, labor union, government to help us delve into the topic that we have. Right. So let me take time to introduce our guest today. Right. I can see Dr. Nsiah has not joined us yet, but I can see Dr. David Chung, who is the General Secretary of the Ghana Registered Nurses and Midwifery Association. Dr. Chung, you are welcome to the Sankofa African Review.
Prof, I'm with you.
Okay. So let me continue. I have Dr. Nsiah, who is a former presidential advisor on health reform for healthcare policy from December 2019 to January 2025, and also served as the former Director General of the Ghana Health Service. So Dr. Nsiah, you are also welcome. So let's go to the next person. We have, okay, let me put on record. I have known Dr. Nsiah for ages, so I'm just putting on record. My relationship with him does not in any way jeopardize whatever I'm supposed to do on this program. I only do this program as the host. So I just want to put it on record, right? That I have a relationship with him, and that does not create any kind of bias or prejudice based on the sort of question that I'm going to ask him on the program. Now, we also have Honorable Ngame, a labor dispute resolution expert and a consultant, somebody that those of us who grew up in the 80s and the 90s, we got to know on our TV circle. So, Honorable Ngame, you are welcome to the Sankofa African Review. All right. We are waiting for Tony Goodman, who is the Deputy Director, Ghana Civil Service and spokesperson for the Ministry of Health. Dr. Goodman, Tony Goodman, if you are here, let us know whether you are here.
I'm not, but I'm here.
All right, thank you very much. Okay, once more, those of you who are participating, mute your microphone. Hetty, mute your microphone. Kasim, mute your microphone. Okay. All right. Then we are supposed to have Lady Esther Wilson Owusu, who's the head of facility, Senior Mission Hospital, Accra, Ghana. If you are here, Mrs. Owusu, can you please let us know whether you are here? Esther, if you are here, let us know you are here. All right, whilst we are waiting for, let me continue. Here. Okay, all right, thank you very much. So, gentlemen and ladies, you are all welcome to the Sankofa African Review. Now, let me take, I'm going to give all of you 1 minute for you to give your opening remarks, but I want you to situate your opening remarks within the context of the impasse between the President John Mahama's administration and the leadership of the Ghana Registered Nurses and Midwifery Association. That is how I want you to situate your opening remark. It's only going to be 1 minute. In terms of the impasse between the leadership of the administration, like I said, I'm not going to use the word government. The leadership of the administration, whether it's the nurses or it's the administration. So let's start first with Dr. Tinkering. Dr. Tinkering, let's start with you first.
All right. Good evening to you, and good evening to my senior colleagues on the call and all nurses and midwives who are here with us this evening. It's a privilege and an honor to join in such an intellectual discourse. As you said, as a unionist, I would rather prefer to call my bosses the employer, all right? Because government come, employers remain the same, and we deal with employers. Now, just to say that we negotiated a condition of service, and I'll explain why I even disagree with the position of the Deputy Finance Minister when he termed it as a demand of nurses and midwives.
No,
the negotiated condition of service.
Yeah, this is only
absolutely
remarks. Okay, go ahead. Okay, go
absolutely,
ahead.
absolutely.
Sure.
I just want to situate my conversation in the right perspective. So what I'm trying to say is that I may not necessarily call it an impasse. I think that the employer just refused to or reneged on its responsibility because we negotiated for a condition of service. It was signed, it was sealed and delivered. All what was left for the employer to do was to implement it. And the implementation was what created the problem. So as far as I'm concerned, I may not even call it an impasse. If the employer had not reneged on its responsibility of implementing the condition of service, we'll not be where we are. And then I think that as we advance further, I'll be able to lay brought up.
All right, thank you. Let's go to Dr. Siansari. Your opening remarks within the context of what happened between June 2nd to June 13th.
Yeah, over, Prof. I think I'm done.
Yeah, sure. Let's go to Dr. Siansari. Go ahead. 1 minute. Your microphone is mute, Dr. Siansari. Your microphone is mute. All right, let's go to Esther whilst you're waiting for Dr. Siansari to fix.
Yeah, hello.
Yeah, go ahead, Dr. Siansari. Yeah, go ahead.
Yes, thank you very much, Professor Akwe, and also good evening to everybody, all the fellow participants and then the panelists. All what I would say is that I have been in this profession and I've been working in the public sector for a very long time. I've also been in leadership position for I've done more than 3 decades leader. What I don't think any person in leadership, either in government or as a CEO, as a head of a hospital, should like to see is any health worker going on strike. And for that matter, if the nurses who form the bulk of the health workforce in any health institution will draw their services. So as much as possible, if you are in government or as leaders, we always try to make sure that we mitigate anything which will bring total withdrawal of services of any group of health workers. And that is what anybody who is in position of leadership should try and do. And we should also know that as health professionals and as health workers, even after work, you think about your patient. No health worker, and I want to repeat it, no health worker is happy leaving the hospital or the services, and then especially if you know the patients who will be coming there maybe the following day to your clinic or to your ward, and especially those on the wards who are not well and you have to, for one reason or the other, leave them. Every health worker worth of its salt, is not happy. And especially if you are in the leadership position, you see that it's not a very pleasant thing to do. So as much as possible, or what I will plead with anybody in leadership position is, as much as possible, try and mitigate and make sure that it doesn't happen. Health is an essential service. And going forward, we have to discuss it, how we can make it a proper and true essential service, like we've done for the security services. That's why they don't go on strike. And that is exactly what I want to see that we come out of today, so that we can advise those in authority to make sure that it becomes a true essential service, and it goes with all the necessary things that it's supposed to go with, so that we can have our peace of mind. The health workers also work also with peace of mind and with all the empathy and the happiness that they have joined the profession. It's a profession. It's a vocation as well. And I believe that, as David said, nobody is happy just laying down their tools and then leaving the patients to their fate. Thank you.
All right. Thank you very much. Let's go to Mr. Austin Game. Mr. Austin Game, 1 minute for you to give us your opening remarks within the context of what happened. If Mr. Austin Game is not ready, let's go to Esther. Esther, can you go ahead?
Thank you.
Yeah.
Well, I'm so happy to meet my very good friends online and to have this conversation. To be honest with you, I feel troubled a lot when I hear about health workers going on strike. I have been with the nurses as their labor consultant for many years. Throughout the 8 years of the time Dr. Nsia Sare was presidential advisor, I have been with them. And therefore, I knew about all what they've been doing in the past. Unfortunately, when this trouble was about to start, they did not involve me, because normally I don't agree for health workers to go on strike. At the time of COVID, I used to follow them everywhere they go. The meetings with the president and Dr. Nsia Sare in the Jubilee House, I was always with them. And we attended so many volatile meetings that could have resulted in a sort of strike, but we tried, including they themselves, including David and Perpetual, tried to avert it. So just to put it in a context, I'm so happy for them. They are very hardworking people. I empathize with them, but I don't support errors. That's my principle.
All right. Thank you very much. Let's go to Esther.
Yeah, hello, good evening.
Yeah, good evening.
Yeah. So for me, as a nurse, having worked in Ghana for over 15 years, our stake is to get better conditions of service. We know that we hold our patients at a high level, and there's no point that we want to neglect the care of our patients for anything. But I think that a time has come when we also have to speak and then fight for what we deserve. Our condition of service have been very bad. And for the impasse, it is unfortunate that we got there. I believe that the leadership of the association have worked tiredly, and are doing all their best to have a dialogue with our employers. But it's quite unfortunate that we got there. But it's our assurance and it's our hope that wherever that obstacle is from, we'll be able to jump that bridge and then get to a conclusion, so that nurses in Ghana will get a better condition of service. Thank you.
All right, thank you very much. Let's go to Mr. Goodman. You are the last person for your opening remarks. Then we'll delve into the conversation.
Yeah, thank you very much. Being the last does not mean that I'll be last here.
Right.
For us in the Ministry of Health, we want to say a very big thanks to all those who played role in making sure that our nurses return to work. We also want to appreciate the work our nurses put in the various facilities across the country. We appreciate it. And for us, we at all times will fight for their interest and make sure that whatever is due them is given to them. Today, I was given a message from somewhere, a lady who was actually helping a woman deliver in a very bad state on his way to work, and he saw this and he was doing that for our mother, which means that nurses, midwives will go at all lengths to make sure that the people of this country receive the best care they want. That is why we would at all times champion their welfare. It is just unfortunate that we had to go on this lane and then get people to suffer unduly. We want to say sorry to the people who go to hospital and face some of those hitches, people who go to hospital and are in need of care and do not get them. We are sorry about that. It is in democracy, whilst fighting for your interest, there may be other competing interests, and that may also become a whole ball game in determining which one goes first. We are sorry about what happened, but it is important that at all times we use the best approach in demanding our what is due us. That is why when senior Austin Garment said we should use the best approach, I side with him, because in the ministry we keep saying that we have met our colleagues severally. We have met them, and we didn't think that the strike would have been the last resort to this particular strike that we saw recently.
We'll come to that. Yeah, you made something. You made a very interesting statement. Now, yeah, go ahead.
Okay.
All right. So now let's get into the discussions, right? So what I did was that I sent narratives, right? The narratives just to give you an idea in terms of what you need. You need to know, right, in terms of the question that you might expect. So let's start with you first, Esther. You are a practicing nurse, a practitioner. So I sent you a narrative which says nurses as essential workers and sacrificial lamb, where I gave you an article written by Isabella Bachman, where he was making the argument in terms of what happened in the US in 1918 with the Spanish flu, which killed a lot of soldiers, and the nurses were able to intervene. Then also what happened in 2020 in terms of the death. So the US considered nurses to be critical and essential for our system, right? So there is a history of what they are being through. That is how they came to the conclusion that nurses are critical and essential to their economy, to their health, to the healthcare delivery, and to society as a whole, right? So there's a history. Now let's come to Ghana. Ghana has not received any serious pandemic until 2020 when we had COVID, right? Now, I can go back and tell you what happened between 2013 and 2016 when we had Ebola across the West African region. It occurred in certain countries like Sierra Leone, Liberia, Guinea, but Ghana was spared. So we didn't see any serious pandemic or endemic breakup in Ghana except COVID. Now, as a practitioner, right, do you feel that we as Ghanaians in our society, the way we say nurses are essential services to our society, do you feel that way?
Hello. Sorry, before you come in, Madam Esther, the host, please, can you increase the capacity, because there are hundreds of our people stranded and knocking to join, and the capacity here is only 100, and there are thousands of nurses who want to join this platform. So if the host can increase the capacity for us, we'll be very happy. Thank you. Sorry for interjecting.
All right. Now, okay.
So if you know that,
go ahead. Esther, go ahead so that I'll ask.
What do you know about? What do you want to know about?
Alex, can you fix that for us? Alex, can you fix that for us? Esther, but go ahead, Esther.
She will not give me my privacy, so that I'll find a seat in the car.
By the time that she was going out there,
Okay, I told you earlier on when you join, you have to turn off your microphone, right? Esther, I've given you a little background how the US came to recognize nurses as critical. And I sent you the article. They have a history in 1918 where they have the Spanish flu, which killed a lot of Americans, and nurses were called in. Then in 2020, so they consider nurses to be very, very critical. In our situation, we've not had any serious pandemic apart from what happened in in 2020. And prior to that, between 2013 and 2016, there was Ebola outbreak in West Africa, but we were spared. So as a country, do we have in our DNA, to view nurses as very critical? Do you see yourself as a nurse as very critical to our economy or to our healthcare delivery? Do you feel that way?
Yeah, thank you for the question. I think it's a yes and it's a no. For me, there are some section of the public that's really uphold nurses very high. But yet again, we think that the Ghanaian, the normal Ghanaian, don't really appreciate or understand what nurses go through or the conditions under which nurses are. Yes, we may say that we have not experienced huge pandemics, but for COVID. But COVID has taught us a lot of lessons. What nurses went through the COVID experience is a lot more to inform Ghanaians, to inform our employers that we are essential workers, just as our colleagues in the Europe. We may not have experienced huge pandemics, like I said, but if we go to the interior, most of the times we look at the cities, what happens in the cities. I have had the privilege of working at the remote areas also before. The things our colleagues go through, we see some of the pictures now because of social media. We get to know some of the experiences. People walk through river bodies. People work under very harsh conditions. And these are much more than pandemics. We shouldn't wait for the pandemic to come for us to know that nurses are essential workers. The conditions under which some nurses are working, we can
we are getting breaks. We are getting breaks in your microphone.
Talk about the logistics. You go to some factory, it is not about. We know that there is the essentiality of what the public as a whole has not really appreciated this. And the current strike action that happened, if you followed comments that were going on social media, you know that people still don't understand the essential aspect of the nursing job. Thank you.
Right. Thank you very much. Let's come to Mr. Austin Game. Like I said, we have known you to be on the TV for years, and you've been consulting for nurses. In your deliberation, in your negotiations with government along the line, do you have that sense of urgency that our society see nurses as essential and critical to our economy and to the delivery of healthcare? Do you feel that way?
Thank you. Honestly, from all that I know, throughout my working life for several years in private and public sector, nurses have always been held in high esteem in Ghana here. There may be individuals who would say something derogative about nurses, but as a principle, as a policy, as a standard, nurses are always and have always been held in high esteem. That is why when we're crafting the Labor Act, they were placed as essential services, just as was confirmed by Dr. Nsiasare. So their matters are handled, supposed to be, let me put it that way, handled differently. But you know, Ghana, our economy is not as buoyant as America or as any other country. The nation can only go that far, you know, in the build-up of this relationship. But important to note is that nurses are always held in high esteem from the time I opened my eyes and being in Ghana for 70-something years now. I think nurses are held in high esteem all the time.
Right. Thank you very much. Let's go to Dr. Tinkurai. You have been dealing with nurses over the years, right? Do you feel that way, right? Do you feel that nurses, Ghanaians see nurses as critical to our economy, very essential to our economy? Dr. Tinkurai. Okay, he just sent me a text message that he has experienced light off. So let's go to Dr. Nsiah-Asare. Dr. Nsiah-Asare, you were trying to make some analysis in terms of the way we view the security forces. Do you think the way we view the security forces as very critical and essential to our economy, we get the same special treatment to nurses? Do you feel that way?
I would say yes and no. Yes, I agree with my brother Austin that we've always held nurses and other health professionals in very high esteem. But if you hold somebody in high esteem, if you go with Akandia, you know what I mean about Akandia? It means if you hold a person in high esteem, the person should be placed in a position like other people who are in high esteem. And that's why I use example as the security services, the judiciary service, and even those in executive and then the parliamentarians. Luckily for us, I've always been saying, and I've said it several times during the COVID period, that I think COVID opened our eyes. Because I believe from my engagement throughout in the health sector, sometimes I feel strongly that, and I feel a bit sad sometimes, that we look at health as a cost, not as an investment. Once you start looking at health as an investment, then put food at where your mouth is, isn't it? But if you look at it, but when COVID came, for the first time, at least I'm very happy that I was given continuous, sometimes to cabinet and a group to extend everybody saw that health is not just an it's not just a cost, but you should invest in it. That's the reason why, you remember, there was tax-free for some time. First 3 months it was, we extended it for another 3 months. And then also people who were actually at the forefront were also given some allowances for about 6 months. Because if you consider it in that way, then it becomes, then it looks at that you are looking at health as a very essential service. It's enshrined in the Labor Act, as Mr. Osengame said. But the problem is that it's enshrined in the Labor Act. Have you added all the necessary story to make it very essential? I would say not so. Because I believe strongly that if you want to make it essential like other essential health services in this country, then some group of nurses at a stage should also retire on their salaries. Because where we have a problem in this country is when you go on retirement. Because our social security system is not the best. And I know they brought in all sorts of things that when they are sick, health insurance take care of them. They are exposed. Health workers are exposed. Nurses are exposed to all sorts of hazards at work. If it's not covered by health insurance, who takes care of it? And I've always been saying, if you are still in the service, yes, somebody will see you. Maybe you can go back to your hospital. But it's when you are out of the service and maybe you are not staying at where you were working, that's where you feel the pinch. So if all these are not taken care of, and then conditions of service maybe are delayed and it's not done, then everybody will be agitated. And that one, you consider yourself as you have to survive, and then also you look at the patients that you are supposed to look after. Because we are all bound by our regulators. We swear oath. So that is where the problem is. And I believe that, as somebody rightly said, I think during this last impasse, another problem that we had were people who didn't understand the work that the nurses do,
Okay, Dr. Nsah, sorry. Let me pause you, but let me go to Tony Goodman. Tony Goodman, you've heard some of the perspectives shared by our panelists. Some of are saying that yes and no, right? Now, Dr. Nsah was going to an area I've been listening to covering the media, right? There are all kinds of narrative we tend to paint nurses as uncouth, uncultured, and all sort of things. How do we change the narratives, right, to make Ghanaians acknowledge and realize that nurses are an essential aspect of our economy, right? Like they say, health is wealth. So if health is wealth, we need them. And they are so critical and they are so essential to our economy, the delivery of health. How do we change narrative? You being a spokesperson, right? At least you've seen some of the narratives on TV. I don't want to get into that. I don't want to give people the space. So I'm not going to say that. How do we change the narratives, right? To make Ghanaians realize that nurses are an integral, critical, and essential part of our economy.
Yeah, thank you very much. At least I've been here for some time now. When this whole the first condition of service, the first ever, which was thought about, maybe we had some earlier, but earlier around 2015, thereabout, when this, so 2014, 2015, when this whole conversation started, it was because the health worker, the nurse, was given that premium, was placed at a higher place in terms of healthcare delivery. We were saying that when you talk about health service, the first person you meet and the last person you meet in terms of healthcare service is the nurse. And for that reason, if you are giving the nurse something, it is his or her due. You must make it a deliberate point in giving them something. So going forward, I believe that what has happened, the narrative, the way people see nurses would have to change. And it has to maybe change by also we regarding places some.
How does the Ministry of Health play a role in changing those negative narratives?
Yes, that is what I'm going to say. Placing premium, as we have been doing all this while, on the work they do, assisting the various associations in churning out the right communication. I believe that if the nurses are respected, it has some positive positive outlook for us, the Ministry of Health. If I go to hospital and I come out and then we have some perception about the nurses, it means that the next time I won't go to hospital, what I will do is that I will be looking at the herbal medicine, which is not approved. I will be looking at some osofo because I have lost faith in the healthcare delivery. So I believe that we have to use all that we can as ministry, rebrand the nurses and the image of the nurses. Recently we were all watching TV, an investigative journalist who also put some information there and trying to let nurses look so bad, let nurses look so inferior in healthcare delivery. I believe going forward, all of us, we must see nurses as people who will do all this particular strike action. A doctor called and said, we are going because the nurses are not here. That tells you how important it is.
Mr. Goodman, you still haven't answered my question. My question is, what role, right? What role should MOH, because everything comes to the head of MOH, what role should MOH play in educating Ghanaians, right? No matter what they think, no matter what negative implication, you use the word positive outlook, which I'll shift to think around later on. But what I'm saying is that what role in terms of MOH linking up with NCCE for them to educate Ghanaians to acknowledge the fact that these nurses are an essential workers and they are sacrificial lamb that we use in areas of the pandemic, in terms of pandemics?
Rob, I've just mentioned one, the collaborative effort that is needed between us and the association. In terms of rebranding, NCE has their work, which is not to brand associations, not to let Ghanaians know what associations do. They have their mandate. I am saying that it is proper for us to come together. We should not be seen as antagonistic or people who are at loggerheads. We should come together and let Ghanaians know the work of the nurse, how important they are in the scheme of things. And then the other thing also is for us to also place premium in terms of when we are having negotiation. There are things I was telling Think Crime that I don't know how some of those things that went on actually have in terms of itemizing the thing, clothing allowance, like some of the things that were mentioned. I was thinking that. Okay.
We'll get into that.
So I am saying that these
are
some of the things that we need to do collaboratively between the two of them so that we'll clear some of this. We all know, we are in Ghana here. We know the way people go to hospital and speak to nurses. They speak to nurses like that because of the long-held view and perception. It may not be the nurses today, because we believe that the training we have given the nurses, we've given them professional training. We've taught them how to interrelate with persons that comes to them. But it is a long-held perception that people have, and we have to work on this and clear it. Because the work nurses do in our hospital.
Let me come to Dr. Tinkran. Right, you've heard what have been said already. Let me use some of the key words that have been used. Right, you need to create a positive outlook. You need to rebrand. So there's some sort of perception. Is it that it's as a result of the failure of those in academia who are not able to train these nurses to have that positive outlook, that Ghanaians tend to have that kind of negative perception about them? And in terms of rebranding, so you need to rebrand. So isn't that an indictment on the nursing profession itself, or those who train the nurses?
Right. Thank you very much. And let me apologize. I went off briefly because I experienced a light off here, but thankfully my genset is on, so I'm back. Well, I think Tony has spoken well. And when he talks about rebranding of the nursing profession, it doesn't mean that educators or those who are training or who are churning out the nurses or today's nurses or today's generation of nurses are not doing their utmost best. The rebranding rather should go to how the employer places value on the nurse. Now, there's no denying the fact that the employer recognizes that nursing and midwifery practice is the fulcrum around which the health sector revolves. But when it comes to compensation, we are forgotten. And if my brother Tony is talking about rebranding, it's not rebranding in terms of course, I mean, we need to look at attitudinal change and all that. But if what is due the nurse, if by law, nursing and midwifery is classified as essential service, but you don't recognize them or you don't put premium on them in terms of paying them what is due them, no matter how they rebrand themselves, they'll be looked down. People have a certain perception.
Let me just interject you briefly, right? Are you saying that it's a quid pro quo, right, situation? If you give me what I'm due before I'm going to consider myself to be an essential worker to create that positive outlook. Is that what you are saying? It's a quid pro quo. If you don't pay me well, I'm not going to create a positive image.
What I'm saying is that
we're talking about them being essential workers. Whether they are paid well or not, their service is still essential and critical. So it should be a quid pro quo. Give me this and I'll give you that. It shouldn't be that case.
Listen.
Wouldn't you agree with me?
I agree with you to a large extent, but what I'm trying to establish is that no matter how the nurse or the midwife brand himself or herself, if the employer does not put premium on them, the old health idiosyncratic posturing of the public will still be there. Let me give you a typical example. One day I was going to buy a canned beef, 2003. And the person who was selling the canned beef knew I am a male nurse. What a person said, hey, nurse, and wants to buy a canned beef. Nurse now all better canned beef. You see that perception, because they know that they don't pay us well. When we go to the negotiation table and we negotiate for better conditions of service for nurses and midwives, it doesn't get implemented. So if the employer does not implement what we have negotiated, how would the public even give us the necessary respect that, oh, what these people are doing is important, and therefore let's also respect them or reciprocate that kind gesture. So I'm trying to establish that until the employer places that premium on the nurse and does not see the nurse or the midwife as a sacrificial lamb. Oftentimes, we are heroes today, we are heroines today when there is pandemic. But when it comes to remuneration, they look at our numbers and say that, look, we cannot afford. Meanwhile, what they are asking for may not be anything more than what every other health worker is enjoying. So I'm saying that the employer must take serious steps to orient its posture towards the ordinary nurse or a midwife. Of course, we have certain attitudinal changes that we need to work on, but what goes to the core is the premium the employer places on the employee, called the nurse or the midwife. If they recognize that our work is the fulcrum around which the health continuum revolves.
Okay, since the original narrative was sent to Esther, you are going to have the final word on this very issue. So Esther, listen carefully. Now, we are Ghanaians, right? We don't know what sort of negotiation that you have with government. We are not aware. But they are saying that it's like a quid pro quo relationship. If you are not paid well by the government, then you are going to have a negative attitude towards we as Ghanaians, and we as Ghanaians must accept you as essential workers. Is that the way you see it, Esther? You have the final word.
Yeah, hello.
Yeah, we are saying that for us to accept you or accept you as essential workers, it should be conditioned on the fact that you are getting good remuneration from your employers. Is that acceptable?
Yes. I agree with that condition of service that nurses have been working with. I think all of us on these platforms.
No, but what I want to understand is that why should it be a quid pro quo? Esther, why should it be a quid pro quo? The quid pro quo is between nurses and government, and you want us to accept you as essential workers. So why should we be involved in whatever is happening between you two, but you are not looking at it from our perspective for us to understand you as essential workers? Why should it be there? Why don't you focus on us who should accept you as essential workers? And your focus is rather on your employer.
Oh, yes. Like I said earlier on, we know that there's a section of the public that's really uphold nurses up high. And likewise, there is a section that have their own reservation about nurses. But just as the General Secretary is saying, Dr. Tinkwan mentioned, if our employers who engages us do not also put us at that level, it will be very difficult for the public to also accept. We are working for the public, but if they are our employers, we are also working for them. And we want them to acknowledge and put us at a certain par so that the public would, just like he was giving an example.
We are negotiating.
You go to places and people think that as a nurse, you are not supposed to have this or that. You are not even supposed to be at this level. When the strike was going on, if you only followed the conversation, some we didn't even know that now we have nurses, doctors, that are professors.
Hold on,
and
Esther,
a lot of
Esther, let me ask you this question.
Yeah,
Esther, let me ask you this question. Who should be the biggest advocate for nurses? Who should be the biggest advocate for nurses?
Yeah.
Is it not the general public? And the very general public, who should be your advocate, you are showing an attitude towards them.
No, the public has their role to play, but I think government also have a bigger role to play when it comes to advocacy. Because we work for government and we for the public as well. Advocate for us. We need the government who are our employers to also come in.
Okay, I'm just surprised about the quid pro quo situation over here. But let's move on. Right. Let's go to the next narrative. The next narrative, which I consider to be the state of nursing in Ghana, right? I sent you a narrative which talks about the state of nursing in the US, especially in New York.
Make a comment on the last narrative.
Okay, go ahead. Go ahead, Dr. Siasari, go ahead.
You see, the most important thing is that you employ somebody. You sit down with the person or the group of people. You agree on some conditions of service. Because the employer, mostly the largest employer in this country of nurses and other health workers, is government. So the most important thing that if government thinks that because of numbers we cannot start immediately, or we can start or something, that is where I say the proactiveness comes in.
No, but Dr. Siasari, what we are discussing here is that, Dr. Siasari, hold on, Dr. Siasari, hold on. The discussion that we are having over here is for the Ghanaian to accept nurses as essential workers.
I'm coming to the Ghanaians.
Okay.
Ghanaians want service. And they go and then make sure that the service is provided for the attitude and all these things. I think it's a continuous professional development will shape that. But the most important thing is that the employer, who mainly is the government, who is also holding brief for the Ghanaians, should at least quickly meet in a middle way to make sure that Ghanaians will also get the benefit of it. But it's not the nurses against Ghanaians. It's the nurses against employer, who should also sit down and make sure that at least something should be agreed to, and then you move forward from that angle. I think that should be the solution.
Okay, thank you very much. Well noted.
But for the attitude maybe to nurses and other health workers, I've always been saying that any patient who goes to any hospital has about 3 different ways of at least making sure that whatever problem he has is sorted out. From the management, from the regional, from even the head of department, and they can go on to the highest level. But most people don't follow that. They just, what you see is the following day they are in there. Now the social media bombarding and blasting when they don't even understand what actually the work system there is and what happened. That's where the problem is. So we should also educate the public. We should educate the general.
Okay. All right, thank you very much. So I said another narrative, which is on the state of nursing in Ghana today. Mr. Goodman, right? Can you briefly describe the state of nursing in Ghana today, the nursing profession? Can you describe it?
A perfect workforce, a workforce that has gone through a lot of stages and is currently being celebrated worldwide. A workforce that in the past never existed. As I speak to you, we have even gotten to a state where countries are calling in to have our nurses exported for them to come and work in those countries. We never had that when we decided to.
Since you hold on, since you brought this issue up, let me try to expatiate on that. When you say recently the Minister for Foreign Affairs went to Jamaica and there was some sort of agreement for nurses to be exported to Jamaica, right? Does it mean that Ghana has so much excess of nurses that we do not meet them in terms of nursing patient ratio, that we have too many, that we are deciding to export some to Jamaica? Or is it that we do not have the needed resources for them? Which is which? Is that we have too much, that we don't need them? Or what is the rationale behind it? Especially with this administration, what is the rationale behind it?
Thank you very much. This migration of nurses have been there for how many years now? And that is the reason why the allowance issue was actually introduced, so that after training them, you would be able to bond them for them to produce or to work here. Fast forward, we've been able to expand training in Ghana. We now produce a lot of nurses in Ghana. we have not actually met the WHO nurse to patient ratio, but don't also forget that you need to expand infrastructure. After expanding the infrastructure, you'll be able to place the nurses in all these infrastructure across the country. There are districts where we do not have hospitals, or we do not have the complement of healthcare system. Talked about the chest compound, health center, polyclinic, and a district hospital. These communities will have to be accessing healthcare in adjunct district or community, which means that if you have placed a health facility in that community, you will definitely have nurses going there. Don't also forget that you cannot also use all your budget allocation for the health sector for nurses or for medical officers recruitment. You must stagger it. That is why, as I speak to you, for over 4 years now, we have nurses who are home, who may need employment one way or the other. It is because we do not have the facilities at some places where they are needed. In terms of the northern part of this country, the western north of this country, you need to expand and now send health professionals there. So what we have decided as a country is that to have them idle in the house, to have them be in the homes and engage in other deviant behaviors, it is important to export them to where their services will be needed. In the past, they were going on their own. They only moved without any backing from the states. Now, what the country wants to do is to back them, have some arrangement with those countries, make sure they get proper accommodation, proper salary, proper health care when they get there. Then they are sent there so that we'll be able to monitor the number of nurses we have sent into this country, how they are taking care of them, the knowledge they are acquiring. And when they come back to this country, they will be able to.
What is the guarantee that they're going to come back? What is the guarantee that they're going to come back?
Because it's an MOU or collaborative effort between two countries, you have a period for which they are going to serve there. After they finish serving that period, the other country will just release them back to you. However, if you want to maintain them, those who went to Barbados,
Tony Goodman, Tony Goodman, hold on. Let's be realistic. What you are talking about is an ideal situation, right? I know that for a fact. You are talking about an ideal situation that they have to rent, they have to return. I can give you so many cases of people from the scholarship secretariat who have gone to other countries to study, right? And they change the terms or conditions and they never come back, right? Okay, let's hold on.
You are talking about studies. This is a different program. This program is a two-country bilateral agreement where you go after you are finished. You are released to your country. If the country wants you to stay, they come into a different negotiation, and that is done. The Barbados program I'm talking about, the first batch and the second, those who went, as I speak to you, some want to stay, and the country renegotiated their agreement, and they are there. So it's not as though, because you didn't go on your own, you went on the back of the states, you go there, and then when you want to stay, the country must know. Unlike where you just take your bag and then you go. No, there is no control. We don't even know the knowledge you have acquired. There are people who want to come back home, but because the system wasn't structured when they left Ghana, it is difficult for them to now reintegrate. The renewal of PIN and all that is not done for them. So it's difficult to reintegrate. But the current position, what we are doing now, you can go, if you want to reintegrate, it's very easy for you to do that. And I believe we just have to support this idea. If you are home in Ghana, you are not doing anything, it is better for you to go and be useful to this world.
Okay, Dr. Nsiah-Sarrey, during your administration, the 8 years of administration, there was a huge exodus of nurses to the UK, right? And few nurses that went to the UK. Now, according to what Tony Goodman is saying, we as a country, we've not been able to meet the World Health Organization nurses to patients ratio. And here is a case we are having an exodus of nurses. Isn't it a green light that we are giving to those that we need for them also to leave voluntarily?
Thank you very much. There's some reason that Tony Goodman was giving, which I don't agree with him. That because there are no hospitals, that's why we don't employ nurses. That is not the case. Nurses, some of them are at home because of the capacity of the largest employer to employ them. So that should be made very clear. Because there are a lot of existing hospitals which I'm very sure they haven't had their nominal role even fulfilled. Nurses are trained, and this arrangement, it's not the first time this arrangement has been done. I'm sure he also knows that in the, I think, early in the 90s, late 90s, we had a similar arrangement with, I think, one of these countries. Is it
Jamaica?
Jamaica. You should ask him how many of them came back. It's a way of, when they finish the 2 years or so, they have a very free, they say, to go to America. They do America exams. The same thing with the Barbados. If you ask me personally, this is for my personal opinion. I think if you continue doing that, when the Barbados issue came, my personal opinion is that we haven't filled our nursing quota here in this country. And then we are sending people. And mind you, these countries, the nurses that they need are not the nurses who are at home. Because Barbados, I knew that they used to come here and do their own interview and pick the few nurses that we have, for example, perioperative nurses, intensive care nurses that we need in this country. So when we had COVID, we had a problem. We have to start using the students who were doing perioperative to go and cover the COVID centers. So we should, as a country, try as much as possible to make conditions very favorable and put health maybe at another stage. And that's why I said health is an investment, not a cost, so that we can have nurses. And when you are posting nurses, the reason why we don't have enough qualified nurses maybe in some of parts of the country is that when they go there, there's not even accommodation. That's the reason why when we did the Agenda 111, we also were thinking about medical villages, rural incentives, so that somebody who is staying in Accra, somebody who is staying in Bunkrugu, there are differences in the allowance that they collect. And that one, I think, should be done as quickly as possible. So doing this, then, it's not the first time it has happened. And I can assure my good friend that you don't see that they'll go 2 years, they'll come back. Only a very few of them, for one reason or the other, may come back. But the most important thing is that let us look at the conditions. Let us look at what goes with it, especially the other incentives for people to move into the underserved areas. That's the most important. But I'm coming that you were asking, what is the condition, what is the situation of our nurses here? Gone are the days where we were having, we started with QRNMA. People were even doing a job. But now, anybody who is going to do a nurse is also even to enter any of the universities. Now, luckily, most of the nursing training colleges are turning into degree awarding. Yeah. We have many nurses. We have nurses who have PhD. For example, my nephew David is there are nurses who have masters in MPhil and the rest. So Ghana, so far as we are concerned, the quality of our nursing have improved considerably. So it is never true that nurses are people who couldn't pass West Africa Examination Council who go to do nurses. When I heard it, I clenched my teeth.
All right, Dr. Ansah, thank you. Thank you very much. Thank you very much. Let's go to Dr. Tinkran. Dr. Tinkran, you've heard Tony and Dr. Ansah, right? You say we're making the argument that we have not met the WHO requirement in terms of nursing patient ratio. At the same time, we are exporting nurses to other countries, right? Isn't it a ticket? Isn't it putting a lot of pressure on those at home, right, to be meeting certain requirements. And that is what is calling for their condition of service, because it seems like they are doing too much work, right? So we want you to tell us what is the state of nursing with respect to those who are leaving and who are never going to come back, and those who are back home, and those who are likely to voluntarily leave.
All right, thank you very much. And then, yes, the state of nursing in Ghana, as has been alluded to by my two senior speakers, is good in terms of the production and of same. As I speak with you, we have most of the nursing training colleges beginning to run degree programs. We have quite a number, or if you go to University of Ghana, for instance, we have over 40 lecturers with PhDs, quite a number of professors. So if I tell you that, I mean, to put it simply, I can tell you that the quality of nursing, the level of training, and the level of expertise and competences have doubled and has tripled, and we are up there. The standard of nursing practice is up there, and that is why we have become so sought after the world over. Now, it is true that quite a number of our nurses and midwives have left the shores of Ghana. And that's why I keep saying that if there is any time that any employer will be minded to motivate nurses and midwives, is today, or it is now. Quite a number have left. We have not replaced them. And the few who are breaking their back and bringing smiles into the faces of nurses, patients and their relatives are not being motivated. So there is a burnout syndrome, okay? Look, if you visit...
You are saying that there's a burnout syndrome. The burnout syndrome is as a result of your organization allowing some of you to move away, creating a few people which leads to burnout, and therefore you are calling for high remuneration.
It is not my organization. How do we ask people to travel? Of course, I mean, migration is a right, and nobody can restrict it.
In terms of what we had with Barbados, it was an agreement.
So it was government to government. It was a bilateral agreement. It wasn't union to union. And so we come in, we don't come in at all. So what I'm trying to establish here is that we have quite a number of nurses who are wasting at home, who need to be reskilled and upskilled, even if we absorb them today. What the employer must do is to employ these young nurses and midwives to augment the workforce, and especially when people have left the shores of Ghana. Now, when it comes to the bilateral agreement, then like what Dr. Nziasari said, we are offering nurses and midwives to countries, to a receiving country. We should be able to strengthen our negotiation power to the extent that we will offer them what we have, not what they want. I see no reason why we should ship away critical care nurses when COVID has reared its ugly head, when we needed people to take good care of the good people of Ghana. So we should be able to tell them, you are coming from UAE, you want degree nurses. Okay, we can give you basic degree nurses. We can give you diploma nurses. Take it or leave it. And I'm telling you that if we posit in that manner, they will receive them. Recently that I went to Helsinki, I met some few chief executives who are nurses and midwives who were, I don't know whether they were there to strike deals and all that. If I get opportunity, I'll speak to Tony and his boss about it. UAE, for instance, are looking for nurses and midwives. All right. So we should be able to strengthen our negotiation stance so that we will offer them what we have, not what they want. So if we have trained diploma nurses and they are at home and we can demonstrate that they are competent enough, their skills are up there, and they can fill in the request has been made by those receiving countries, we should be able to make that a position very clear and loud. Instead of allowing highly skilled nurses and midwives to leave the shores of Ghana, whilst we also improve the service conditions. Because if you don't improve the service conditions of those who are highly skilled, they will leave. Now,
all right, thank you very much, Mr. Ostigami. Listening to the three panelists so far, right? What is your take on all that they have said? Mr. Ostigame, listening to them, what is your take on what they have said? Migration of nurses, and they are burned out we don't meet the whole requirement, but we are sending away, we are contracting them, they are not going to come back, and we need to have a proper negotiations. What is your take on all these things?
Well, thank you. Look, my friend, the nurses are not unaware that we have several other professions in Ghana here. All of us subsist on the same exchequer. So there is so much that can go out for everybody, but there is limit. I participated actively in the construction of the condition of service on which they went on strike. Like I said, I was not contacted by them. I would have, and they know, prevailed on them that, look, there is a way to go. Because I've heard severally, I teach industrial relations at master's level at Legon and in many other countries. So I know exactly, and I was the chairman of the committee that wrote the Labor Act. I know very well that the nurses have genuine cases. But the point is this: if you have customers, and the customers are your patients, principally, they are your customers, and you abandon them because of a negotiated collective agreement that is not being implemented.
No, Mr. Sigami, we will come to the condition of service. But my point is that we have not met the World Health Organization requirement in terms of nursing patient ratio. We are now contracting some of them to go out to other countries. That means other people can also leave, and the few that are left are burned out. Isn't it that an indictment on the state of healthcare in state of nurses in our country?
It is true. It is true. However, the truth is that the state is unable to employ all the nurses that have been trained. A lot of them are at home now, including my own cousins are at home now, waiting to be employed. And so therefore, it's only appropriate that we do not make them look stale, because there is a time period which, when you are not practicing and you have to go back, a lot of things will be required. So I think it's only fair that we open up and give them opportunity wherever their services will be required. Those that will be needed can be gotten at any point in time. But the reality is that the state is unable to employ all of them. Even those that we have employed, here we are unable to meet some of the conditions of service that they needed. I mean, that's the reality. Let's confront it.
Esther, you have the final word. We want you to paint a picture of the state of nursing in Ghana today, listening to everybody.
All right. I think I do not have a different view from what the panel members have said. We know that we have traveled a long way, and now, with regards to training, we have come to a point where we are training less. We have less specialists who consult on their own and help to take care of patients as well. We can boast of nurses that are lecturers, doctors, professors. So I think we have come a long way and we are doing well. What I will also want to add is it is good if we think that we have to export some nurses outside to also go and help. But I will also want to repeat what Dr. Chimpine said. For us on the field, our care is on the side where experienced nurses are being exported or are leaving. You can never compare a nurse who has been on the field for more than 5 years to a newly employed nurse. The truth is, when they are employed for a year, it is a new training altogether. You have to train and retrain them for them to fit into the system, especially now that a lot of them stay home for 2-3 years. They come to the clinical field and there is a knowledge gap. So we think that we should export. Then we have to look at the type of nurses that are being. Thank you.
All right, so let's come to Goodman. You have the final word on this particular topic, right? So based on what we've heard so far, government doesn't have a problem with exporting them. Those that are left are burned out, and they put pressure on the government for government to have more remuneration or condition of service. Is that something which is sustainable in the long term?
Yeah, I agree with Senior Othengame about this. It will be difficult to say that government can employ all nurses we are training. In the past, I keep saying that if you are educating nurses, the idea is that you want to give them job. But after training them, it's also difficult to give them job. But what you have given them is that you have liberated people from ignorance. So you have educated people. Unlike you saying that, because the idea was that, okay, if you can't recruit them, then limit the number of nurses you train. Instead of, if in case you are supposed to train, say 50, train just 10. Now I keep saying that you would have 40 people who will not be educated. So it is important to train the 50, and then when you get to the job market, you manage that aspect. It will be difficult to say we are recruiting all nurses who are home today. It's not possible. The other avenue we have, which is making sure that where their needs will be needed, you send them there. Somebody said that it is not true. Prof also said, Prof. Nsiasan also said that when they go, they may not come back. For us, we look at what the agreement says. The agreement says that when they go, after 2 years, they can come. If the agreement expires and you think that their need will not be, coming back to Ghana will be difficult for you, and their needs will be needed somewhere, why not post them? So I believe that what we are doing is that we are training for Ghana, but when it comes to healthcare, every country is important. You may find yourself in
what
where
I'm saying is that, are you doing that at the expense of your own citizens?
we are not.
Because
We are
there
not.
are people. No, but you said what nurses to patient ratio, you've not met that criteria. So if you are not meeting that criteria, you are exporting some people who should have access to them.
Your line went a bit bad.
I'm saying that you said we as a country, we've not been able to meet World Health Organization requirements. So, and if we have not been able to meet them, and we are sending the few that we have away, are we not denying our own citizens access to nurses?
No, we are not doing that.
Okay.
If you look at this at the back of financial constraints, you don't want them to be in the house without doing anything. You want to make sure that they are useful to Ghana, they are useful to themselves, and they are useful to the world. So that is what it is. If you can't give them the job here, make sure that the period they will stay at home, they are used somewhere for their own benefit. And that is also helping. It is a policy that has come to stay. We are going to make sure that the more we train, we make sure we get them into our system and then get some to help where their services will be needed. We were benefiting from Cuba. Prof, we're benefiting from Cuba.
Let me follow up.
When we also needed their services, when we didn't have doctors, there were countries. Cuba was like us, but they were producing the medical officers for us, and they were helping us. So if today we are in a global village, part of our budget is being financed by other countries. So if their services are needed elsewhere, and we are not able to recruit them here, why not? Let's just make sure that they go and serve those countries too as well.
Yeah, let me try to put this thing into its proper context, right? Now, somebody made a statement that it is impossible to recruit all nurses, right? Now, we've had a lot of mismanagement of resources, corruption in the government sector. We're talking about billions and billions of dollars being repatriated elsewhere in terms of illicit financing. These are a huge amount of money. Are you saying that with all this money that is being mismanaged in the country, if we are able to efficiently utilize these resources, we cannot employ all these nurses. Is that the argument you are making?
It's an area I don't want to even go in, because
it's
some
not,
of the statements.
The question I'm asking is not peculiar to you alone.
As we are fighting corruption as a country, corruption is everywhere. Corruption. Let's not let it look as though corruption is only in Ghana. That is for
the argument I'm making is that somebody used the word "it is impossible," and I'm giving you a reference that if you look into the Auditor General's own report, that misappropriation of funds, mismanagement of funds, if these monies are used to employ nurses, that cannot be an impossible task to do.
No, you see, that is what we are all doing, making sure that we have state institutions that are plugging the holes where the corrupt practices are happening, making sure acts of parliament are promulgated to make sure that these things are dealt with. State institutions are making sure that we kept corruption to the barest minimum. Whilst doing that, for us in the Ministry of our target is to make sure that the professionals we are churning out, we churn out the best of professionals, get them to work in our institution. If you have challenge in terms of financial constraint and their services are needed elsewhere, we do that. The corruption, the state institutions that are mandated to do that, we'll deal with them. However, for us,
you are saying that it is possible. It is possible to employ them.
It is possible.
It is able to take care of what they are supposed to take care of.
Yes, it is possible.
Thank you. Thank you very much. All right. Thank you very much. Let's go to the next narrative. The next narrative is negotiated condition of service in Ghana, right? It's linked to the next narrative. So let's come back to you, Mr. Austin Garment. You have done a lot of negotiations, right? I want us to get into key considerations when you are negotiating. Key considerations, some of the things that you consider key when we are negotiating for what condition of service in Ghana. Dr. Ostigame. Can you hear me?
Chief Game.
Yeah, I'm trying to find out from you, Mr. Austin Game, what are the key considerations that are factored when you are negotiating condition of service? I'm not talking about
honestly, we have not even started implementing our Labor Act properly in Ghana yet. We are supposed to move away from the traditional adversarial approach of negotiation and during implementation. The law is very clear on it. So, for instance, under the law, section 1012 and 1034, we together with the union, that is the association, and the employer represented by Fair Wages, we put together our own rules that will govern the procedure of the negotiation and also after the negotiation. When there is an industrial problem, dispute, in fact, we have before, during, and after the negotiation are all critical. When before the negotiation, you have to share information, relevant information on the economy, on the situation generally in the workplace, so that you factor all these things into the negotiation. Now, the employer sometimes, and that's why nobody should blame the nurses for what have been put into the agreement. It is the employer who voluntarily agreed to the things that they are capable of doing it, even though they did not do their homework very well. That is what
we'll leave this thing for Dr. Sianse in our next narrative, but go ahead.
In effect, when we agreed to it, when we come to implement, and we have a committee, a standing negotiating committee that negotiated. The standing negotiating committee is a body that has the highest decision-making, is the highest decision-making body that negotiates. Nobody interferes. Now, when we conclude, and during the implementation, there were challenges. In fact, before the present employer took over, there were challenges. That's why we could not implement it in full. I attended the meeting myself with the minister, Mr. Kwekwa Menu, and the nurses, and we agreed to stay off some of the things, set up a committee to ensure that we have it implemented properly. Albeit, employer and the government is continuum. Therefore, having inherited the condition of service, it's only proper that we take our time and ensure that if they have challenges, the same committee that sat and negotiated can sit and do some variation, not necessarily in the condition of service. There are several ways of dealing with it, including staggering, varying, and ensuring that the implementation process do not become a hindrance to health service delivery, because our customers cannot be abandoned. That is the patients that we take care of, because there are standards below which, when you go as a nurse, as a health delivery service people, you create a problem for everybody, including the nurses themselves, who can become also sick. So clearly, I was really troubled, and they know I got involved. I tried to talk to them, but because they were in that high level of, the spirit not wanting to come down to the level of all of us, there was nothing anybody could do until they got satisfied, and they and the parliamentary service people, parliamentary committee on health, went and reached this kind of agreement. But the long and short of it is that the two parties, the employer and the nurses themselves, could have resolved the matter. They could have resolved the matter. But everybody...
Okay, let's focus our attention on the 2020, the condition of service, which was supposed to be implemented, right? It started, negotiation started in 2023 and it came all the way to 2024, right? 2023, we're having challenges in our economy, right? We're going to the IMF and things were a little bit more difficult. Then it runs all the way into an election year, right? Would you say that the condition of service that was negotiated, right, took into consideration the economic factors and the fact that we were entering into an election year, and maybe the government of the day would like to what? Be on the side of the nurses so as to be able to get their vote to win their elections. So could it be that a problem was created as a result of that?
To be honest with you, I would like to stay away or veer away from the partisan aspect of the politics of Ghana, because you can be easily misunderstood, and it doesn't help anybody. Yeah. All I want to say is that the employer was supposed to share information that will help in the negotiation. Okay, give me a second. I know, as somebody who lead negotiation in various other places, I know they did not share the information in total. What the nurses would have loved to have, and which was my position, is about getting good pay, because no nurse retire on allowances. I've told them severally, and they know it. No nurse retire, no health delivery service delivery person retires on his allowances. So we would have paid them well and leave out this mushroom of allowances. Unfortunately, everybody thought that when you get a lot of allowances, it may cushion you. It does not help at the end of the day when you are coming on retirement. As to speak, some of them are about to retire. How are they going to calculate their little money? It's based upon their pay and not allowances. So in the future, this should be a lesson all of us will learn. In the future, we should not necessarily go in for positional negotiation that if I want this, I don't get it, let the whole sea get bent. No, that should not be the case. We should share information, because we don't have only one set of working people. We have thousands of working people who subsist on the exchequer of the nation. And so we can only go this far and that far. I think that this is a very good lesson. In the future, though bitter that it may be, if we have learned lessons from it, we should all learn lessons and not repeat the mistakes again.
All right, thank you very much. So if you look at the key consideration, it talks about realistic expectations. In 2023, when the negotiation started, we were still in an economic crisis. In 2024, we were an election year, right? Would you say that the negotiation, the condition of service, in terms of what you negotiated, was very realistic, based on government capability and capacity to be able to deliver it?
That's what I was saying. The employer failed to properly share information. Look, let me use yourself as an example. If you are a married man and you earn, let's say, $2,000, and your wife asks you, how much do you earn? So that they will know how to budget. And you didn't share information because you don't want your wife to know how much you earn. Your wife can ask you amiss. Your wife can ask you for 1,500 for a month. Can you afford to pay 1,500 a month when you earn $2,000? You may not be able to afford it. That is the essence of Section 97 of the Section 97 of the Labor Act, that says that the employer should share relevant information, and if the workers also, the union also has information relevant as it may be, they will share it so that we all know where we are. It's not about the economy wasn't doing well, we all know. So there is so much the employer could pay only and may not be able to pay some. But to just avoid some turbulence in the system, they give what they think they can afford. You know, and here we are sitting here today. This other person has come and say that, no, this thing I cannot afford it. But like I'm telling you, I lead various negotiations, both private and public sector, today also. And if we don't share information, we are not sure of what can be done, we don't give it out, especially where I am representing the employer. We don't give it out, because you do that is to your own peril. So here we are, we suffered it already. I think we should learn bitter lesson from this. In the future, the employer, what they can afford. The nurses are very important. I empathize with them. Like I said, if they can afford to pay them well, and they will retire on that pay, which will be used to calculate and which they will subsist on, is better than paying mushroom of allowances. When you retire, do you get pin matters? Do you get uniform matters? And so forth. You can afford to give some. Those that you cannot afford, don't pressurize yourself.
All right. Thank you very much. Dr. Tinker.
Absolutely. Let me help Papa Gami in responding to your questions. Let me state categorically and respect that we started the negotiations in 2024, January. We presented a tall list of proposals, okay? Because when you are going for negotiations, you consult all the labor unions that you are legally aware of their existence, seek for their inputs, and harmonize those inputs as a collective proposal. When we tabled the proposal before the Fair Wages and Salaries Commission, we established a framework of negotiations, all right, the ground rules for the negotiations, and include what you were seeking to elicit from Papa Gami. I want to say that out of the tall list that we presented, we were impressed upon by the government or by the employer that the economy wasn't in the best of shape. So they were not prepared to admit any new allowance. You see, that is where our pain is. That is where our pain is. So they refused to admit any new allowance. All the new allowances that we tabled, all right, they refused it. And they told us that they can only enhance few of the allowances. That's why we have 8 main itemized allowances. In fact, let me pick one example. And since then, it keeps dwindling. We was, as part of the negotiations, we were looking for the market premium to be unfreeze. Now, they made us aware that they cannot unfreeze the market premium. So they will give us 8% In fact, we said if they cannot unfreeze the market premium, then they should give us 25%. Okay, to augment the market premium. But initially, I mean, during the implementation of the single spine, the junior ranks got about 58% of their basic salary as market premium. As I speak to you, it's about 13%. The principal nursing and military officers got about 65%, and above got 75%. And then the nurse consultant and senior nurse specialist got 100%. As I speak with you, it has dwindled to the point that our junior officers are having 13%, 15%, and 21%. So we were asking that if they cannot unfreeze the market premium, then they should give us 25% to augment that dwindled market premium. And they gave us 8%. And the content of our condition of service is being enjoyed by all health workers. So it's not like, oh, they gave nurses some preferential treatment and the government couldn't, if you like, pay. It's neither here nor there. In fact, we didn't get what we were expecting, to the extent that some of our young folks, especially those breakaway unions, virtually condemned us of doing virtually nothing. This very condition of service that the current employer is struggling to implement and making it look as if it's so pregnant. We were told in our faces that we got nothing for nurses and midwives in Ghana. Okay? So we were even thinking of renegotiation, because 1 year into the implementation of a condition of service, there is a clause in our collective agreement that 1 year into the implementation of the condition of service, you can go for wage opener. So we were seeking to even activate the wage opener. So there's nothing in the condition of service that is beyond comprehension for anybody to even contemplate or suggest that it is so much for government to pay. As far as I'm concerned, it's lack of priority. People are putting the economy above the life of the good people of Ghana. And that's what I want to make it clear this evening for everybody to understand. That if you can pay for ex-gratia, if you can pay 150,000 Ghana cedis to an MP to go and supervise a project, and you turn around to tell me that you couldn't factor the condition of service of nurses and midwives into the budget, that means you don't respect them, you don't recognize the work that they do. You know, I'm coming. I'm trying to lay the thing properly for you to appreciate it. So I'm trying to establish that the content of the condition of service is not anything that anybody should contemplate. And I'm very happy Papa Game led the negotiations. What I was expecting, especially Papa Game and other well-meaning Ghanaians, to tell the employer is that implement the condition of service. There is a wage opener clause in the agreement. If you think that there is something in the condition of service that you find it difficult to implement, wait for the wage opener and then bring it to the negotiation table. You cannot, for the life of me, refuse to implement the condition of service and turn around to tell me that it's going to break the economy. Which economy? So you want us to go on strike for people to die? You know that in 2020, when we went on strike, we conducted a research about the impact of nurses strike in Ghana in 2020. It was published in a peer-reviewed journal in 2022. You can look for it. Plus one. It's in there. I can run by you the economic impact of nurses strike. If those so-called economists have quantified the economic impact of our nurses strike, they will not even contemplate of saying that 2 billion is too much. What we are saying is that if 2 billion cannot be contained in, let's say, the media budget, stagger the payments.
We'll get to that. Let's go to Dr. Nsiah-Asare. Dr. Nsiah-Asare, it was under your administration that this condition of service was negotiated and was supposed to be implemented, right? Would you say that the condition of service was realistic, given the economic conditions and given the fact that we're entering into an election year where different labor unions were going to put a gun to the head of your administration? Dr. Nsiah-Asare.
I said, thank you very much. I was off for some minutes.
Yeah.
So I don't know what we have discussed so far.
Yeah. Okay. My question to you that looking at the economic conditions in 2024, the fact that we're also in an election year where you know very well that that's the time that most labor unions go on strike and they put gun to the head of the administration. Do you think that what was negotiated was realistic for government to be able to implement it as we go along? Was it very realistic?
I think I heard some parts of what the General Secretary David said. Mm-hmm. He said that what they were even asking for is not what they got, isn't it? So it means this is a negotiated condition of service. And he also mentioned that the other unions or the other professional bodies in the health sector have also negotiated theirs and they are enjoying it. David, am I right? So it means that it's a negotiation. So whatever was agreed to is what it was thought will be that the government of Ghana can take care of.
Yeah, but my question is, let's put away the other associations or whatever. Let's take with the nurses. But that is they are the issue now. What I'm asking you is that, given the economic conditions at the time, and knowing that what we are going into an election year, right, where association will put a gun to the head of the administration, do you think that it was realistic? What they got was realistic, given the economic condition that was prevailing?
Yes, what was negotiated for was realistic, in our opinion. And as he rightly said, you see, when you negotiate for conditions of service, and you can even stagger it if you think there's a problem. So I'll say that we finished negotiating with them of condition of service, signed off. What took them on, and that's what delayed. And I'm very sure if that they were not taken on and then there was no injunction placed on them, we will not be sitting down here maybe discussing a strike. That's what I would say. So we negotiated with them. So it was a hard negotiation, and that's what the agreement was reached. And we believe that it doesn't matter. Governance is continuing. So either it's election year or not election year, and conditions of service are due to be negotiated, it should be negotiated, unless there's a law that the last year to election, there will be no negotiation of condition of service. But that's not what the law says.
Okay. Now let's come back to you, Tony Goodman, right? So your administration is the one supposed to implement that. I want to fast track and go back into 2024, right? And try to look at the prevailing economic conditions that were there, and the fact that we're entering into an election year where government normally have gone to their head for them to provide certain conditions of service. Do you think that what was negotiated, right, was realistic given the economic conditions prevailing at that time?
Thank you very much. There were a lot of discussions. Let's look at this particular condition of service that has not been implemented as the new one. When you look at the schedule, there is already a condition of service. This is an upgraded version. The old one is being enjoyed, but this was negotiated, and then the differences is what we are talking about. So there is a condition of service. They are enjoying that one already, yes. So I believe that if you go to some of those negotiations, if you go to the negotiation table, clearly what you are looking for, and then the template that will be provided will make you fit into that template. I'm sure Chief GRNMA will tell you the way the template will be developed, you fit into that template. So I believe that it is what the country can afford, what we can take care of. We negotiate up to a point and said, okay, this is where we can meet you. So let's all agree and go on from there. The nurses, I can say that are also strong when it comes to negotiation. So they will push and make sure that what they want is done to them. That is why we got where we are. Now, if you look at it, we cannot say we want to renegotiate, even though Chief GRNMA is saying that some of the things can be re-looked at. We have had some gentleman agreement with the leadership of the nurses, and we are looking at some of them. There is some particular one, which is the rural allowances, which was also discussed. A condition was actually put in place to say that let's go look, let's look at a document that will actually operationalize that aspect of that document. That has also not been done. So yes, what Chief Austin is saying has been done in most of the cases. We don't want to say we want to renegotiate the agreement. A Nigerian film acted by this Sophia. It's an agreement, agreement. So we just have to find a way of implementing and make sure that our nurses are fine.
Okay. All right, Esther, let's listen. Let's hear your thought. Right. Given what has happened, do you think that what was negotiated on your behalf was very realistic? The government is still struggling. Esther, what do you think about that? Given the economic condition, do you think that still what was negotiated, knowing very well that we knew we were going to have challenges, right? We knew that we were going to have challenges to pay this thing, right? Given what was happening, we had junk credit standards. We're on the IMF conditionality where we were receiving $350 million a year. At the same time, what the city was almost 17 to a dollar, something like that. Let's be realistic, right? Looking at economic conditions, do you think what was negotiated was realistic?
All right, thank you once again. So for the nurse working in Ghana, our association that negotiates our condition of service communicated to us, and we had a lot of expectations when they were going to negotiate for this condition of service. But it came as a surprise when we were told that we had to sympathize with our employer, but for the harsh condition, the economic situations that the country found itself at that moment, and then let a lot of them go and stick to this current condition of service. So it also came as a big surprise to us when we were being told that the condition of service we are advocating for is unrealistic. We think that as nurses we deserve better and we are not having it all. The current condition that we are living in, I think the information is out there. What we are earning compared to the current rent rates, transport fares, at the end of the day, nurses go home with nothing. Even how we survive to the end of the month, sometimes it's amazing. So for us as nurses, we don't think this condition of nurses is not realistic, or it's something too big that our employers cannot fulfill for us.
So you were of the view that even if the current administration was maintained, they would still have implemented what they negotiated? Is that
Absolutely.
what you're saying?
Yes.
Okay.
Yes, but for the other groups who felt that the group that went to negotiate didn't do well, and they were even backlashing them that they could have done better, and these issues were taken to court. I'm sure this condition of service would have been enjoying it, because we were told the condition had been signed and we were expecting it last year, July, I learned. But unfortunately, there was a court case and it had to be withheld.
Okay, all right. Thank you very much. Let's go to the as a last resort. So let's come back to Dr. Tinkra, right? When you strike, it is in whose interest do you strike?
All right. You know that
after you have negotiated, after you've done whatever you need to do, you gave your roadmap, and you choose strike to be your last option. In whose
David,
interest?
you are on the spot.
you know that unions have various ways to express home demand for their members. I have said that for the past 24 years, I've worked in the hospital. I don't even expect that the word strike be mentioned. But for the intransigent and belligerent posturing of the employer, So when we go on strike, which we don't, you see, what people must understand is that nurses and midwives are not immune to sicknesses. So it's not out of comfort that we take such course of action. We do so in the interest of nurses and midwives and the public as well. Because if a safe worker saves lives, if I'm not safe as a nurse or a midwife, I cannot save the life of that patient who is coming to me. So when I press home, better conditions of service for nurses and midwives is in the interest of the nurses and midwives and the populace themselves, the citizens of Ghana, so that the nurses can be in a better position to provide that exclusive, essential service that can only be provided by them. So to answer,
hold on, right? Just hold on, right? I'm going to give you a series of strike action that has occurred in the US. In Minnesota, nurses are holding informational strike. That started from June 4th. In Chestnut Hospital, March 19th. In other places, there are so many strikes happening in the US. But let me give you something very, very important that the article that I sent you said. As community advocates, we cannot stand by while monies are diverted from healthcare. Okay, who is accountable to such borders? Okay, let me go back and read. All workers strive for dignity and respect in the workplace and for improvement in the quality of their own lives. Those of us who provide essential services are constantly told there's no money in the budget. Who is accountable for such budget decisions? We are enormous waste. We see enormous waste, unnecessary lavish expenditures, taxes that serve the working class while providing endless benefit to the super wealthy. As community advocates, we cannot stand by while monies are diverted from healthcare and education in order to enrich corporate coffers. Nurses decide to strike when it becomes a matter of life and death for our patients. That is what it said. So you strike when it becomes a matter of life and death for your patients.
Absolutely.
Let me go back. On June 13th, in your press release that that ended your strike, you said we're paving the way for amicable solution for the impasse. In view of, you said so many things, but nowhere in that press statement did you apologize for the loss of lives of patients who your actions have led to that situation. Since you said you strike in the interest of those patients, why there is no accountability for the loss of lives?
Absolutely. That is why I told you earlier on that save workers save lives. Okay? If I'm not safe as a nurse or a midwife, I cannot save any life because we did not swear an oath of poverty as nurses and midwives. Number one, there is something we call vicarious liability. Okay? And that's why I'm very happy when Tony Goodman apologized. Because if any death occasion as a result of our action is on the head of the ministry, and if they have apologized, then vicariously they are responsible for the death. And that is why we did not apologize. It's not to say that we pride in the death of people. Let me tell you something. If you know what apologize for those that die, when we lose patients, you'll be amazed. So when I hear people think nurses are not kind-hearted, I shudder what goes on in their mind. I want to humbly submit this evening that nurses are compassionate people, and they grieve when they lose patients, even when it's not their fault. Okay? But we ought to be safe to save others. Okay? And that's why I'm saying that we did not swear an oath of poverty. And those who hold a certain, impression or a certain perception that nurses are supposed to be poor, they called Florence Nightingale. They don't know the history. Florence Nightingale was born a bourgeoisie. The parents were rich. And that is why she's being touted as mother of modern nursing. She didn't invent nursing. There was nursing before Florence Nightingale was born. So that's a erroneous impression. And that is where the disrespect comes in, even in the public eye. They think that a nurse must be walking on the roadside for a politician to offer him or her a lift. So if the employer places premium on us as nurses and midwives, then it will inure to the benefits or the overall benefits of the patient and the citizenry. So if you were asking me to apologize to the people of Ghana or why we didn't apologize, We did not, because we are not the cause of their death. It was the actions and inactions of the ministry that caused the demise of the people, unfortunately. But what I'm saying is that it is good Tory Goodman has accepted and vicariously apologized to the people of Ghana.
Okay, let's come to Dr. Nsiasa. You have been in the health sector for a long time. Like I said, if you listen to their suspension of statement, they didn't apologize for the loss of lives. We know the vulnerabilities in our healthcare system, right? Some of the strike action that I've read about, there's let's take for it, I live in New York. There's no general strike which affect the whole of New York. It's probably done in certain areas. But in our situation, there's a general strike, and we know that there are vulnerabilities in our system that will lead to death, right? Shouldn't there be a way to ameliorate such situation from happening, knowing very well that people are, why should we be taking decisions that we know that is going to lead to loss of death, loss of lives? But nurses, that is not, nurses are fighting to using strike to better the lives of their patients. At the same time, they are taking a strike while people are going to lose their life. Shouldn't there be a way to resolve this situation, given the vulnerabilities in our society or in our healthcare delivery system?
Yeah, thank you very much. The only way, in my opinion, is one. We have to get a true meaning of what essential health services, essential services is. If you all agree that health is an essential service, then we will do everything possible so that they don't go on strike and the patients lose their lives. That's one. Two, I believe that every health worker who has sworn an oath feels very sad when you lose a patient. I think David said it, even if it is not you who caused the death. If you know anybody who dies in the hospital, the first thing you do when you meet the patient's relatives, you say, I'm sorry. You don't say, I'm sorry because you have killed the patient, but you are empathizing with the relatives. And you are sorry for the death. And that's exactly what happens. And the third one is that whoever is employer in the situation to not allow this thing to happen should be very proactive, should also not make things worse for the nurses or anybody who is on strike, especially allowing ourselves to be taken on by people who don't know the sort of work and the sort of thing which has gone through. Because a lot of people talk when they don't even know what the conditions of service is, what has happened, what stage it is, and all sorts of things. But to conclude, I think the most important thing is that let's look at health sector differently. I remember some time ago, health sector was taken out of the GUS, Ghana Universal Salary Structure. And I think if David and the rest are listening to me, especially the old leaders, some of us in early 2009, when I was still in Kokochi, we told them, continue to stay in the health service salary structure scheme. If that was the case, all these premiums, market premiums, and all these things would not have happened. Because I told them market premium is apparently grandfathering you so that the others workers who wants to be like you will come on board. So going forward, I think this is something that we have to think about it again, because I'm sure in US, in the UK, nurses are on different salary structure. It's not a universal system. It's not a single spine. Single spine maybe is good for some group of people so that they get their salary, but I'm sure my brother, Mr. Osingame, is listening to me. This is something, Mr. Osingame, we have to take it on as a country, and then to make health service and the nurses and everybody as an essential service, we should maybe think again and take them out of the single spine. Because the spine, if it's overloaded, the spine will break. And that's the reason why the market premium and the rest came in. If health workers were to be still on the health service salary structure, I'm sure most of these things would have been taken care of. Because the most important thing is what goes into your pocket, the take home. The most important thing is how much pension that you'll be receiving at the end of your pension. The most important thing are other incentives, the differential incentives, so that you push people, it entices people to where the underserved areas are. And to me, that is the way to go.
All right, thank you. Let me come to you, Mr. Austin Game, right? Now, I live in New York, and like I'm saying, if you are making a comparison, New York has a better healthcare system, but people are allowed to strike. When people are striking, they don't call on a general strike, right? And they have a limited number of days, say 3 or 4 days. Now, look at our system, knowing the vulnerabilities in the system, that a strike, a general strike, will cause a havoc in our system without any definite date, right? But what a nurses considered was an indefinite strike. We didn't know when they were coming back. Shouldn't we rethink that idea of calling a general strike, knowing the vulnerabilities in our healthcare system that is going to lead to the loss of lives? Shouldn't we consider that going forward?
Thank you. Look, I'm being very open and honest to you. My daughter lives with you there. She's a nurse in New York there. She was trained there and is practicing there. We all know the condition under which they employ nurses in all other countries, especially in Europe and America, and Ghana is different. Now, we considered several things in placing the nurses under essential service and all other health workers. And David is listening to you and I. My point of view is that we should have a different sort of salary structure for not just the nurses, but the health workers, and negotiate with them on the basis of where we have placed them. That is why they have 72 hours for their matter to be resolved. When they went on this strike, I wasn't aware. I just heard it, boom, like anybody else. If I were to be aware they had invited me, they know I would have prevailed on them not to do it. The reality is this, and we can still go and sit with the employer and engage them and have a solution that we seem to be getting closer to having now. Would have resolved it the same way. But the point is that it has happened already. It's a bitter lesson, should never be repeated again. What we need to do is to ensure that we have a way of engaging, and also the advocacy on their own self also as a union in branding and advocating and ensuring that the public know or understand where they as nurses stand. The patients that we have, the patients are their customers. They are their primary customers. In fact, they contribute to the payment of their wages as well. And therefore, it is important that no matter the provocation, you should never, under any circumstance, by the very standard that is applied in the health sector, including the nurses and midwives, the standard is so clear that you take into consideration your primary customers, who are the patients. And this will not be extended to the ministry, as David is saying. We, the citizens, we don't know the ministry. What we know is nurses. And therefore, it's important that we get this matter clear once and for all. If you go to Japan, nurses don't go on strike. And we wrote a portion of the essential service in Japan. We sat with them 10 solid days, went through a process with them, including the unions present. The labor law was not written by government. It was written by a tripartite body. And therefore, they advised that we should place the nurses where they should be placed. I've suggested severally, but people are interested in this mushroom of allowances regime that do not help the cause of the nurses and all other workers. I don't mean even just the nurses alone. It's important that I will repeat that you don't retire on allowances. You retire on a certain method of calculating your benefit, however small it might be. But if your pay is enhanced, then you are protected during when you have come of age. So I'm pleading with my friends, the nurses, and all other health workers. Let's prioritize how best to engage the employer. I've heard the president currently saying that they will put together an independent body to see to a new salary regime. I don't know how they will do it, but we don't need to wait for them. You can advocate for it, but we don't need to also be going into the press consistently about our matters. Let's learn to engage the employer behind the scene because it's about industrial relations. It's a relationship matter. It's like husband and wife. If you break the marriage, you are breaking your spirit and everything. So stay focused, engage the employer, negotiate. If there is difficulty in implementing the thing, those who start to negotiate get together and ensure that you advocate and propose how best we could resolve it. If you fail to resolve it, go to the National Labour Commission. And the Labour Commission is not the property of government. It's been put together as a tripartite body. The chairman of the commission is the product of unions and employers association, not government. They all have two there. And so therefore they must have confidence in the Labour Commission and go there and have their matter resolved. Where they have difficulties, that is why some of us are in the system as well. We engage and help them to resolve it and not resort to any form of strike anymore. I agree they got pushed to the wall. I agree they feel betrayed. I agree whatsoever anybody want to say, but the patients are their primary customers. You should remember. Thank you.
Thank you very much. Right. Tony, listening to all these conversations, right, in terms of the vulnerabilities in our healthcare system, and according to the Mr. Game, it's supposed to be 72 hours. We went beyond the 72 hours. It was an indefinite strike, and there's loss of lives, right? Where is the accountability in all these discussions for the loss of lives?
Yeah, thank you very much. Let me go back to Thinkrine's diabolical aspects he wanted to show this evening. I have apologized to Ghanaians for the stress they go through when they go to hospital. You don't take me to my law school. I'm not talking about curiosity.
You get a last word. Don't worry, you get a last word.
It's like that. He always wants to give me pressure. So it's important for us to apologize to the people for the stress they go through, because that is not what they bargained for. For them, it's for them to go to a hospital and be taken care of. That is what they wanted. What's happened, I will say again, is unfortunate, and the people of this country must not be subjected to that. Going forward, I believe this salary regime is what we thought as a country was going to save all of us. We thought the single spine was going to be single. I am a civil servant. I have worked in the service for a very long time, and I know what civil servants take home too. And if you look at if you're not careful, every sector would want a new salary structure. You remember recently, my mother association, the club SAG, also threatened and has also issued some warning to government. So it is not as easy as one would have thought. The pressure on government and the public purse is huge. We know the nurses are special because of where they found themselves. Some will have to work in unfavorable conditions and far away where their parents and they themselves have not lived before. So they must be looked at in a special way. And that is why I believe that I will side with Prof. Nsiasari, that it's proper for us to get a clear salary regime for the health sector, even though we said the goose was not the best and we moved away from single spine. I think there should be a clear salary structure for the health sector where we'll look at even the medical issues they talked about recently, that if a medical officer gets sick and has to pay for hospital bills and all that. It used to be the case that if you're a health worker, you get some money when you go to the hospital and come back. At times, you even bring the receipt and it's paid for. But as it stands now, if you do that, it's illegal. So all of us, even if you work in the Ministry of Health, as a policy wing of the health sector, you go to hospital and pay for yourself and come back. So it is something that, in as much as we may not be happy with it, that is what the policy is. Going forward, we need to look at a clear policy regime for health workers, making sure that their welfare is well taken care of, so that they go to hospital smiling and deliver on the mandate we have promised the people. So yes, it is good. So Chief Gami, if the president said we need a new regime and we're going to work, and I'm sure with your support, we're going to get that, so that we in the civil and public service will enjoy, because we thought the second part was going to change our life, but unfortunately we are still struggling. So the salary is supposed to be taken us leaves out at Tema Station, and that is not the best.
Right.
We are
I don't
trying
see Esther over here. I want to give Tinkra, but I want to hear from Esther. If Esther is not here, let me come to Tinkra. So Tinkra, right, you met with the Select Committee of Parliament, the Subcommittee of Parliament. There were some sort of negotiations where, from what I know, is that there's going to be 4 of the conditions to be met. Right. Now, like I said, I do a lot of work around the African continent. You hope for the better, but you plan for the worst, right? With the 4 conditions, the 4 that you have laid down, right? What if you don't get all the 4? And what happens?
All right, thank you very much. As you are very aware, the strike.
Hold on, we are almost done. I'll give people a chance for them to answer. We're almost done. Let him respond. Go ahead.
So as we are all aware, the strike was suspended. It wasn't called off. We met the Parliamentary Select Committee, can't get through their timely intervention. Our fallback was the 4. We didn't place the 4 on the table. We placed all the 8 on the table. So the 4 is our lowest fallback. And we think that they must come handy on the 26th, because we don't want to go back to where we were. We love our job. What we are asking the Parliamentary Select Committee respectfully is that they should try as much as possible to meet us at the 4, because we tabled 8 and they felt that the economy couldn't contain it.
8 was the condition of service.
Our fallback was the 4, because the National Council agreed to call off the strike or to suspend the strike because of the reports that was relayed to the National Council. Even the 4, the National Council were a bit hesitant. The president had to prevail on the National Council. You see, sometimes when people speak ill about Madam President, I guess so work that. She had to impress upon the National Council for us to accept the 4. So we will not go beyond the 4. I want to humbly submit on this platform.
So my question, that's my question.
Our last fallback is the 4.
Mm-hmm. Okay, so what I'm asking is that we have almost 6 days to go, right?
Yeah.
If you don't get the 4, right, in negotiations, like I said, there should be a middle ground. You want 4, government say, okay, you know what, we can't give you 4, we can give you 3. If you don't get the 4, then what happens?
We wanted 8. Government.
Maybe before.
Listen. Papa, respectfully, we were not at the negotiation table.
No, we understand. We
at
understand
the level of implementation. Our fallback was 4. And I'm saying that we called off or we suspended the strike because of the report that was
David, you are being positional.
Papa, I'm not being positional. If I'd been positional, I would have been 8. I would have stayed at 8.
But for the 4 is position.
The 4 is that's our last fallback, Papa. You know that we always have a fallback. Okay, we have been at this since 2006. I've been with you on this. I'm saying that our team tabled our 8. Our fallback.
The 8 is what is the condition of service. So when you made a select committee on Parliament, you tabled 4 as a compromise. And I'm saying that if the 4 is a compromise, what if you don't get the 4? Government says, I'm going to give you 3. What happens?
I don't want to entertain that conditional clause. As far as I'm concerned, I will not entertain that conditional clause.
Mr. Osindame, isn't that part of negotiation that there should be a compromise in terms of your
No,
position?
the compromise is our fault.
The
That's our
compromise
fault, but
is
that's why I keep saying that.
I have not taught David that.
Okay,
I have not taught him
Mr.
positional
Austin, let's hear from
negotiation.
you. So they have tabled 4 to the subcommittee of parliament, right? And I'm saying that what if parliament comes, if they come back and say, we are going to give you 3, and
Well,
they say, what happens?
I agree with I agree that they have tabled a 4.
Correct.
But when you have tabled 4, and I am the one that will be giving you the money, and
Correct.
I said, you know something, if you want me to give you 4, I don't have the 4. So what it means is that we are going back on strike, because that is what you went on strike, because you were asking for something you were not being given. You felt empathy in your heart for your patients, and when the select committee talked to you, you agreed and you talk about 4. It's now time for payment. And I'm telling you that I have some money for you, but I cannot afford to pay 4. Are you saying that you are going back on strike because you are not getting the 4? That is the essence of the question they're asking. That's why I said, let's not be positional. Because anything can happen.
Papa, respectfully, we are not being positional. I've told you that the 4 was our fallback. And you all know that in negotiation, you have a fallback. And our fallback is the 4. We were looking for the, and don't forget, even, you see, a lot of things have gone. I don't want to put that.
No, but look, Dr. Kuranti, we understand that your fallback is the 4.
The implementation date is part of the process. You see, I don't want us to think that it's only for.
We've done all those stuff. We've gone through all that stuff. What I'm saying is that if government say, I can't give you 4, but I'm going to give you 3, what is going to be the reaction of God?
We will not accept it. Let me be very blunt here. We will not accept it. We cannot be treated with this kind of disrespect as necessary midwife. We have negotiated for a condition of service that has been signed. We expect the employer to implement it in full. If for one reason or the other, the employer cannot implement it in full,
David, relax. Relax.
They must respect the 4 that we agreed upon. If government tries to we will go back to
David. Let's go to Tony. Tony, he has stated.
Oh, you go back. I promise you. If government decides,
David, relax.
You go back on strike.
David, wait. Okay, Tony, you have heard him stated categorically, right?
Yes.
Based
Please.
on the proposal they have tabled to the Parliamentary Subcommittee on Health, that the 4 is not negotiable. It's 4 or nothing else. And if the 4 don't happen, they are going back to strike action. What is your take on that? I want you to give. We want you to speak on record. I want you to speak on record.
My ADR class did not teach me what David is doing. That you try to be so hard and positional.
I am yet to take the ADR class.
Go ahead. Yeah, good man.
Go ahead. I believe that we pray and hope that they are met some way, somehow.
But you have to plan for the worst. What I'm saying now, you have to plan for the worst.
Oh no, we won't, because as said, nurses do not want people to go to hospital and suffer. No, I'm not sure that is the calling. That is not the calling. Government has received the 4 and is deliberating on it. We cannot be jumping the gun. That is why the way David is working himself this evening, relax. Nothing has happened yet. When by the time the dates get, maybe you may get more than that. Why are you so worked out? So
we know the way things work in Ghana, and government is not charitable to give 4 when government is not that charitable. We know that government is not going to give more than 4, given the fact that they're talking about shortfall. So, in case that they said 4 and government cannot do, and they go back to their strike action, what will government do? What option would government have?
Let me suggest something before he comes in. If you give me the chance, I would like to suggest that the employer, being government, should not wait till for the 26th.
Correct.
If it were to be me, by Monday there will be a meeting. Tuesday there will be a meeting to enable us resolve whatever different. That is the meaning of proactivity. And let me also advise that going forward, we must all respect the structures that we have. We have a standing negotiating committee. They must respect it. 2, we have the National Labor Commission. We must respect it because every problem must have finality so that we do not go in circles. Otherwise, when things go bad, if even you say the employer being government should apologize and they apologize, and so what will be the outcome? That the damage has been caused already. No matter the apology, the damage has been caused already. I would like to plead with all sides. We should not wait till 26. Immediately, we must trigger a meeting of the Standing Negotiating Committee meeting. I have told this meeting that negotiation does not end during implementation. It goes on till the collective agreement will no longer be there. The world has collapsed. Every collective agreement continue until it is renewed. So please, let's not wait till we go back to strike again. Let's have a meeting now.
Okay, good. But before you come in, let me go to Esther. Esther, you heard David, right? You've tabled 4. That's your fallback. Government comes, God say, okay, you know what? 4, we could give you 3. David saying you are going back to strike, knowing very well that people are going to die. How is that possible?
For us as nurses, we belong to a union. And
no, we are asking your personal opinion, right? Your personal opinion, knowing very well that if you go back to the status quo, which is a strike, people are going to lose their lives.
Yes. So no nurse wants the association to declare a strike. Seriously, the current strike that went on, it came as a surprise to me, and I knew something had happened at the leadership front. I knew dialogue didn't take place. I knew negotiations, things had gone wrong up there, because we never want to go on strike for our patients to suffer. And bear in mind, if there is any strike action, not all nurses stay home, because we have patients on admission, and especially some of us who are nurse managers who have to stay on work for more hours than normal to take care of these patients. So we never want any strike action to happen.
Okay, Dr. Siasa, if you are there, right, will you respond to that? That it's 4 or everybody should go to hell? Okay, let's go to Tony. You are listening to them. They're saying that it is 4 or everybody should go to hell. We're going back to the status quo. We are going to strike to see people die again. What is going to be your reaction towards what David said?
For us, we advocate for the nurses as a ministry. That is our mandate, because they are our staff. So when it comes to negotiation, we advocate for them. We will make sure that we get in touch with the powers that be. You remember, this whole issue, it's about implementation, and it falls within another domain. We will keep doing the follow-up to get the needed result. Whatever we get, we will let them know.
But whatever you get should be 4. He is making it clear. Whatever you get should be 4 or more, nothing less than 4.
Yes. So whatever we hear or whatever result we get from the implementer, we'll come back to them and have a conversation with them. So when we get there, whatever conversation there is, we'll discuss it. It's not everything we can come out and put out there, but we hope that at the end of the day, there will be some sanity. There will be some
this platform. This platform is giving you an opportunity for you to know that it should be 4 or nothing else, nothing below 4. Because you've heard him say it clearly.
You see, it shouldn't look as though the employer is the one going to pay the people today or meet their demand. There is another government agency in charge of that. We are advocating for that. We are fronting for our nurses We will go and see whatever there. We will come back and have conversation with them. We are the mother. So when we go, okay, when we went, this is the story. We'll call them and say, okay, this is how we want. So let's go around this way. This is how we think we should go around. This is what we have done. What we did earlier, we have not put that out. You can ask Thinkran. There are a lot of things we did at the back. Anytime we go into this, we do a lot of things with them. It's just unfortunate that they think that the ministry is shielding the whole thing too much. So they went behind it and they went overboard and we had what we had.
Okay.
We'll still continue to go and get what we have to get.
Thank you very much. Now let's listen to David. David, you have a question, right? David, go ahead.
Yeah, so I just want to humbly say.
No, not you. Not you. We have another David over there.
Oh, okay.
David Nyaba, right? Go ahead.
Yeah, I'm just trying. I'm a member. I'm GRNMA member. I'm a nurse, and I'm also an NDC member. I want Goodman to know that the nurses that went on strike were not MPP. If NDC says that they don't want us as nurses, we don't have problem. But he should check my name. I was a polling agent, and I'm an NDC.
We don't want to go to that.
We are talking. Wait. We are talking about. We have been talking about patients are dying. We are not talking about the nurses that die every day. Have we ever had a platform like this to discuss the problems that nurses pass through? Mr. David, Dr. David is just giving us the raw emotions of us. And then people were thinking it is political. It is the political mentality from Goodman and then that of the health minister that have caused this.
We are dissecting the issue.
The grassroots emotions that I've given you.
Dennis, we are dissecting the issue. We are not trying to get into politics, right? So we understand that. Okay, you are a member of the Nurse Association. What David is saying is...
saying that it is therefore, or we all will advocate that they should implement what our leaders have tabled, or we will back them. We are not backing them because we are MPP. We are backing them because we are nurses.
Stop talking about MPP, NDC. Stop talking about it that way.
Okay.
You are creating the problem.
Let's go to Alfonso. Alfonso, go ahead. Okay, David, okay, let's go to Alfonso. Do you have any questions?
Okay. Thank you very much, sir. I want to take this opportunity to greet my boss, Mr. David Thinkran. So I'm a GRNMA district executive in the Kumfi district, a very rural district. And I want to register my displeasure on behalf of a number of nurses. When the employer issued a statement, the first one, trying to say that GRNMA is one of 5 associations who do not want to work or something like that. We want to make it clear as a grassroots nurse that that statement and the position of government to use retired nurses and the other splinter groups was very disrespectful. And I thought the government could have done better by consulting more rather than meeting those 4 other groups which are not members of the main association. And I know that by now they've seen the impact of what they did. So please, respectfully, government should be mindful when it comes to these things and know that GRNM is not one of 5 associations, but is the main association and the only association. So thank you very much. And next time, let's be minded. Thank you.
Okay, Mr. Austin Game, people have made that assumption that the minister trying to rely on nurses who were on retirement was a wrong move, right? I've seen situations like that in some states in United States.
That was a very desperate measure the minister was taking, and he has very little choice than to take such desperate measure because of the intensity of what was happening in the system. Let's be very real. I mean, let's not pretend that things did not go terribly wrong as a result of the strike action. Nurses are very, very important. Me, I've been working with them for many years now. And let me be very, very clear here that when there is a strike action of this magnitude, the employer has very little opportunity to jump. If it were easy, they could have said, give them the money, $2 billion if that is the figure, 2 billion, it is better for us to pay 2 billion than to have 2 people or even 1 person dying.
Yeah.
So, but it's not as easy as it is. Managing an economy in a country like ours is a very, very, very awful kind of thing. And that is the reason why the labor law enjoins the employer and the unions to sit and share relevant information to enable. The union are very reasonable people, and the law enjoins both parties to make every effort to reach a reasonable agreement. And we have always endeavored to reach a very reasonable agreement. That is why I'm saying that we should not wait till 26. The yesterday things, as far as I'm concerned, they are gone and buried. If we want to go and be referring to it, we will only waste our time and our energy. The important thing is, what do we do going forward? And I agree with you that they are asking for 4. If there is no 4, so the whole country should come to a standstill and let damn the consequences.
There
It
should be
cannot be
4.
so. It cannot be so. Let's
Okay,
get together
let's listen.
and have a good conversation about the way forward. That's my stand.
Okay, let's listen to Emmanuel Akpalo. Akpalo, what is your question?
Yes, good evening once again. And yes, I've been following the discussion so far, and I must say I'm very much disappointed in government position when it comes to how nurses are being paid. And I'm also disappointed that at this 21st century, they are still here talking about how nurses should be paid. And I am seeing government position like giving us an emotional blackmail. They only know that we are essential service providers when it comes to strike. But when it comes to service delivery and payment, nobody considers the nurse as an essential service provider, which is very bad. We are talking about patients dying because nurses are on strike.
Those conversations, and we
Yes.
made an argument that even people in New York complain that they say there's no money and things like. We get that. But what we are saying that we are looking going forward. We have 6 days. Government has tabled, GRN has tabled 4 proposals to parliamentary subcommittee on health. What we are saying is that what if government comes and government say, you know what, you asked for 4, we're going to give you 3. Does it mean that you are not going to take the 3 and go back to the status quo where you are going to demonstrate, which is going to lead to the loss of lives again? Is that what you're saying?
You see, the whole thing is that when you have a father or you have a mother, you by all means know the capability of your parent or your father or your mother. And we know what government can do. We know how monies are being spent in this country. So we know exactly what we are asking for. And then we know government is capable of doing it. When they are denying us of what we are due, then we'll continue going on strike until we get what we are due. So we are not going to take anything less than the 4 we are asking for.
Okay, let's go to Naomi. Now let's listen to you.
Thank you, sir, for the opportunity. And thank you for this wonderful platform. And I hope it will not be only on our strike, but another time you organize something to know about life after retirement. Then, like, it keeps going. My question goes to Mr. Tony Goodman. When I came into nursing, at the ministry, there is an office allocated for nurses. There is a nurse that also advises the minister on issue of nurses, because a nurse understands what the nurse goes through. But as I am sitting here, that office has been closed. So I want to ask, who is advising the minister? Because the PRO himself seems not to be informed. He is my friend. He has been the PRO for a long time. So the way he is behaving is really amazing me. So I want to know why.
Naomi, I know Dr. Koku Awono, right? Is the technical advisor to the health minister. This is somebody who has had so many years of experience. So the question that you are asking, I've given you the answer. Awono, Dr. Awono is the health policy advisor to the health minister who has a lot of experience in the health field. So you think he's not giving the good advice?
Yeah. Oh no, you see, the one who is doing the job knows what the people feels. That's why you can see Dr. Tinkran, he's even about crying. He's very paid because this strike, it wasn't the executives that called for the strike. It was the members, which will make them feel bad. We strike against them because we want them. If they don't call for this strike, we ourselves will remove them from power.
All right, thank you very much. Let's go to Bright Ajiman. So, Mr. Goodman, you are taking note of the questions, right? Bright Ajiman, yeah, next question.
Yes, good evening and good evening to fellow colleagues. Honestly, mine is just to add up. The question that the lady just asked that you attempted to answer, the technical advisor to the minister is not a nurse.
Okay.
There used to be a nurse who was heading that portion within the ministry, advising the minister when it comes to issues relating to nurses and midwives and the profession. And you see, the posturing that government is taking, to be honest and fair with you, is getting a lot of nurses and midwives more angrier than before. I am of the opinion that government should actually live by its dictates of stating that nurses and midwives are essential workers. If you consider someone as essential and the person has tabled 8 things or 10 things or even 20, and based on negotiation, the person says, okay, I know you can't give me everything. I am not asking for everything. Let's meet. Give me this. Let's start with this. Then we think of how we are going to work on the others. And you think this person is not being reasonable, please. Government should.
All right. Thank you very much. So, Dr. Goodman, he is also advocating for the office of the nurse who advised the minister because Dr. Wono is not a nurse. Let's go to Haruna. Let's go to Haruna. Haruna, let's hear your question.
Benjamin.
Any consent? Yeah, go ahead.
Thank you. Thank you. I'm much honored to be called upon to also share my view here. Please, what I'm saying is that if Mr. Osengami says Dr. Tinkran is being inquisitional, I would say no. Why am I saying that? Because we, the association, I am the PRO for the Association Asante Region. The association met with the employer and we all agreed that the 8 allowances, these 8 allowances will be given to us. Now we have been more charitable. We've come down to the same need of the employer, bringing 4 on board, and we have accepted. Now we want us to go below 4 again. Then it means we are not ready to give it at all.
No, Haruna, let me say, you've tabled 4 proposals to the Parliamentary Select Committee on Health. It's a proposal that you table to them. Then they have to go and talk to government. And government say, okay, we understand, we're going to give them 3. Are you saying that if government says it's going to give you 3, you are going to go back to the status quo and go and strike, which will lead to the death of people again? Is that what you're saying?
Yeah, I would say so, because no, please, in point of correction, we did not table 4 for proposal. No, we went there for the 8. And based on consensus,
8 is what is the
listen, please.
Condition of service.
No, yes, that's what we went.
What is the condition of service? Then you tabled 4 that needs to. Don't forget, I know a lot about this thing, so I know what I'm talking about, right?
Okay.
So 4 was tabled. 4 was tabled to the Parliamentary Committee on Subcommittee on Health. And I'm saying that the Parliamentary Committee is going to go and negotiate with government. If government comes back and say, okay, you say 4, but I'll give you 3. You are saying that, oh, no, we're not going to take 3, we're going to take 4. If you don't give us 4, we are going back to the street and demonstrate, which is going to lead to the death of people. Is that what you are saying?
In fact, this question, like I'm saying, when they even came out to even inform with the other executive out down there, in fact, we accepted in the good faith by the 4, okay, let's accept it. But if it's anything less than 4, then I might be frank, we have to save our life too. As there's a midwife, we are ready to save our life down here, and we cannot risk our life to go out there and work.
Okay, let's listen to Albert Ofori Dawson. Right, let's stick with the 4. 4 table, government comes, say, I'm going to give you 3. You're not going to say, no, we're not going to agree, so we're going to go to the streets again. That will lead to the death of people. Go ahead.
All right. Doc, thank you for giving me the opportunity to speak on the platform. I'm also the assistant PRO for Ashanti region. I'm much worried about the notion that when nurses goes on strike, because people die, whatever they need is not much relevant.
No, nobody's saying that. Nobody's saying that.
No. I heard you say that, so you go, so people will die. I mean, you said that, and it's giving the posture that it seems it's only nurses who go on strike and people die. But we have doctors who have been on strike for days, for weeks.
Listen, at this point, our conversation is about nurses.
Yes, I understand it. But the posturing of government and people who are supposed to come in to mediate for the right thing to be done are putting some posturing as if nurses are only causing the death of people. No, this is something that the people, the nursing fraternity wants. And if you think they are essential, you should really consider it and do it. I mean, it's a mutual agreement. Do it in a position where everyone will understand and then be comfortable with what you want to do. But bringing it out as if nurses want people to die, and that is why you go and demonstrate so that people will die. I think that posturing is giving a negative impression about nurses. They don't want people to die.
Listen, hold on. Why do you call it posturing? When we know very well that when nurses go on strike, what has happened before, right? Just what you did recently, it led to the death of people. So that is a reality. It's not a posture. It's a reality of the situation.
But Doc, I had a question to ask that when doctors go on strike, people don't die.
We are not talking about doctors for now, right?
No, yes, I understand, but they are all health professionals.
Okay,
and
no,
they
speak
had
with nurses. Let's speak to what we know. We know that when the strike happened, people die, right? And don't forget, you are
yes, of course.
With the 72 hours. Okay, go ahead.
No,
Okay. Hold on. Tony Goodman, you are hearing a sentiment, the position that they have taken, right? So, what is going to be your how are you going to reach out to them? You have only 6 days to go. Tomorrow is out, Sunday is out. So basically, you have only 4 days to go, right? And this is the position that they have taken. What are you taking note of at this point?
I'm taking note of their issues. I've written some of them down, and that is what I'm going to communicate to my superior. But let me answer some of the questions. Let me quickly answer some of the questions. Let me say this, that my colleagues, at times when they come out of anger, the way you speak, it doesn't augur well. Naomi has just displayed a lot of ignorance, and I'll just pardon her for that.
No, I don't want us to go there. I don't want us to go there. Tony, I don't want us to go there.
No, Prof. What she did.
I don't want to personalize issues. I don't want you to personalize
I'm not personalizing this issue, but let me just go straight to the way she spoke, as though we don't know what we are about here. Who said that the chief nursing officer's office has been scrapped? It's there. There is an officer there who is working. There is a technical advisor who advises the minister. There is a chief director. There are other directors here. There is a technical coordinating directorate here. There are various directors that work here. But to let the whole thing look as though, and then to add sort to injury, that Goodman himself, who advises the minister, doesn't know. I have been in civil service, I'm sure, before she even started this whole nursing thing. It was wrong for you to say that. When we are demanding things, let's demand a thing and take people emotions and people personal attack aside. It is, if you don't know, you ask whether there is a technical person who advises minister on nurses matters. Yes, there is. So, and just to let the whole thing look as though the ministry does not. When we started this whole thing, I was measured, and I've spoken about the way the ministry has led this whole negotiation issue. We have not actually communicated this thing well to the nurses, for the nurses to know that what is happening is the ministry that is actually leading this for them. maybe when Chief Osmengame was talking about the way there is a standing committee, there is an implementation, all of these things, I'm sure most people do not know about it. The role the ministry played, we do not know. So it was as if let's go and attack. Let's go and attack. No, that is not it. One of my colleagues here said we refer to GRNMA as one of the associations. Yes, on document in Ghana here, the nursing fraternity, we know we have 5 nursing associations. Even if it is one person who is in that association, it is still an association registered by law and has been given due certification. So if we refer to them as one, it is not wrong. It must be the largest, but it is one out of the 5. So I don't see anything. If out of anger, you may see if the person is even laughing, you would think the person is crying because you are angry. So
Okay.
please, let's not see the ministry.
Thank you very
Let's
much.
not
Thank you very
antagonize
much, good
the
man.
ministry as if
Let's come to
this matter is between the Ministry of Health and the. No, Prof. Let me put this matter is not between the Ministry of Health and the nurses. They must know this. They must know this.
Yeah. Let's go to our elder statesman over there, Mr. Austin Game. Listening to the nurses, right? The position they have taken, right? You can see the emotions coming out and things that we have said, right? The attitude and all this stuff. What advice would you be giving to them based on the 4 proposal that has been tabled, right? What advice will you be giving to them? You've mentioned that there should be negotiation from now. Government should not wait till 26. There should be tomorrow is out, Sunday is out. So basically we have 4 days. Government should be very proactive. It is only a good man who is here, right? He is going to go back and read the information to the Honorable Minister. What do you think? What advice will you give to the nurses at this point for the next 4 days?
Well, it's good. It's good. Everybody is pouring out his feelings about what's going on in the nursing fraternity. Whatever they are fighting for now has been put together by their leaders, and I'm no stranger to it. I was with them in the back room in making sure that these things are done. So clearly, the intent here should never be that we want to fight. We don't fight when it comes to relationship vis-a-vis the work you do, particularly we're talking about where they work. I concede that as far back I can recall from 1970 to date, the situation had never changed so much. Relationship between the employer as the state and the nurses, the improvement is that they now have a union. In those days, they don't have a union. I know when the union came into being, I know it. So I just want them to be aware that where we have gotten to is not about emotionalism to the highest core. It's about everybody relax. Let's talk about the issues that confront us. You have customers that you serve. I repeat, the nurses and the health service delivery, they work as a team and they have customers they serve. These customers are the patients. If you abandon them for any reason, let me repeat, for any reason, you have a concern to address tomorrow. And if I heard David said that the employer being the state government would have to be the one apologizing, if they apologize, I can guarantee you to we the people who go to the hospital and we are served by the nurses, we don't know who is called government. All we know is that we've been to hospital, the nurses have either provided us good services, mediocre, or whatever it is the nurses we know. We don't know anybody. So please bear that in mind. And when we are talking, let's take away the extreme emotions, considering the fact that we are not properly remunerated. I agree. But we are a country of over 34 million people, and we all have different facets of the economy, including the nurses. the situation can be handled in a manner that will be mutually satisfactory to everybody. It may not be entirely palatable for all of us, but David knows, I know, I'm sure Esther knows, that negotiation, you don't get all what you want. When it comes to implementation, it's at the heart of the finality of the thing that you negotiated. And therefore, if there is a problem, the only way you can resolve it is to go back and have a conversation about how the implementation can be handled, either through a stagger or through a certain methodology. The parties are the people who must sit down and talk about it. I want to plead with everybody. Relax yourselves. We should not wait till 26. I would like David to inform his boss that we should go to the table, even if it's a Sunday, to go and engage again. That's a better way to do it. I'm grateful to all of you.
All right. Time is almost gone, right? Probably. Let's see whether we can take 2 questions. But David, let's come to you, right?
My hands have been up, or my hand has been up.
Okay, hold on. I'm going to call you. Hold on, I'm going to call you. David, we are not saying you are not going to get all the 4, right? 4 is reasonable. But in the event government comes and say, you know what, we understand the demands and whatever, you've compromised to come to 4, but we'll be able to give you 3. That is what we are talking about. We are not saying you might get more than 4, right? But we are saying that in the event that you don't get the 4, and government say, okay, you know what, let's give you 3. I don't. What would you say to those who are here now?
What I want to humbly appeal to the ministry, to government, is that we have compromised enough to the extent that we are ready to look at the effective date, number 1. Number 2, we are ready to stagger the implementation. Thirdly, we are ready not to insist on the implementation of the signed collective agreement. So whatever we tabled before the Parliamentary Select Committee on Health, government must come through with it. And if they deem us essential service providers, as has been captured by the Labour Act 651, then if I were a government, I'd rather even do more than what we have tabled. We think that nurses over the years have been impoverished and have been taken for granted for far too long. And they should listen to our plea, at least, so that we can have, there is something, no, Papa knows, because something presentism in industrial relations. Presentism is a form of strike. And that's why sometimes I wonder the haste for the employer to go for, what do you call, injunctions, because I can go to work and I'll not work, and that's what is referred to as presentism. Nurses and midwives can present themselves early in the morning at the workplace and they will not work. It's also part of industrial relations. We don't want to go there because we love our job. What we are asking is that don't let us write the good of nurses at the seashore and then the wrongs on the brass. Don't use nurses and midwives as sacrificial lambs during pandemics. And when it comes to remuneration, we think that they do not matter. We think that we have compromised enough. They should come through with 4 or even more. Thank you.
Okay. All right. Thank you. We have 10 more minutes, right? Let's give Julius. Julius, let's hear from you. What do you have to say?
Thank you,
You have 10 more
sir,
minutes. Only 10 minutes. Yeah. 3 hours.
Thank you, sir, for the opportunity. Yes, I'm Julius from the Upper West region, Nandon to be specific. I want to ask a simple question. With negotiations and agreement, it is a two-way thing. One has a part to play and the other party has a part to play. Currently, we have negotiated and come to an agreement which needs to be implemented. So nurses are playing their part and government is also supposed to play its part. If it is the case that government is not able to play the whole of its part, is it the case that nurses should also relent in certain issues? Thank you.
All right, let's listen to Ibrahim.
Okay, so thank you for the opportunity.
I actually think that we have compromised enough. And what is actually the compromise? What we have gotten is not what our members actually want. And so I think that implementing this is nothing much. If the government really believes that we are essential service providers, I think giving us the extra 8%, giving us uniform just once in a year, and giving our senior colleagues fuel is nothing that the government has issues providing. In any case, all the other unions within the health sector are taking these things that we are asking for. Why? Even the orderlies in our facilities are taking uniform allowance. So why is it that it is difficult for the government to provide these things? I actually think that for me, if our general secretary and our national council doesn't proceed to get us these 4 things, we will insist that they call another strike. If not, we'll call a strike against them.
Okay, Dr. Tinkerai, can you clarify this thing for us? The 4 that you have tabled that needs to be implemented is supposed to be implemented for the rest of this year, right?
Absolutely.
Correct.
From July 1st July 2024, 2025, sorry, till December. Then the remaining,
that's for the 4. That's only for the 4. Right?
That's only for the 4, precisely. And that's why I'm telling you that we have compromised enough. And it is time for the government to do the needful. So then the remaining 4 will be taken care of from January. Even the 4 that are supposed to be implemented this year, the arrears will be staggered. The arrears, we are not saying, it's not like they are going to pay everything together. We are saying that the arrears of the 4 that we have agreed upon will be staggered, even up to December.
Okay, all right. Let's listen to Laurentia. Laurentia, let's listen to you.
Hello, good evening, and thank you for the opportunity. I think the basis of this discussion was there was a roadmap from GRNMA to government. And the roadmap, even with the wearing of red bands, was for 2 days. So under no circumstance should anybody, the employer should say the nurses were not considerate with our patient. Then in as much as you can say that to the nurses, then we can also say that the employer was also not, didn't care about the citizens because there was a roadmap and everybody saw the roadmap, including the employer. So I don't see where the employer kept mute and decided to employ the services of our old mothers, our new colleagues, rotation nurses who were brought into the system not quite long, and they were even ready to even employ the services of student nurses, which wasn't the best decision. Whilst you want to export your experienced staff, your experienced health workers to other countries, while your own citizens, you want them to be taken care of by student nurses, by rotation nurses, then I think the employer had a huge, let me say, the employer didn't really care about the citizens of the country, not the nurses. We didn't do anything bad.
We've had that conversation already. Thank you very much.
Yeah, so the fact that if the 4 is not given, then it is like the nurses are the one who do not care about the patient. I think that one is wrong. It is the employer, and the employer should take
Laurentia,
yeah.
I want you to complete that statement. If the employer does not meet the nurses with the fraud proposal, what will the nurses do? Complete it.
Yeah, so we are looking at our executives. Even if the executives say no, we the ordinary nurses, we the members, we are going to let the executive do whatever they are supposed to do. Because we have to be healthy, we have to have a sound mind, so we can also take care of the people who they have been entrusted in our hands.
Okay,
we cannot
Laurentia,
go to the workplace and you are broken inwardly just because you want to please the eyes of people. So they have to let us also get that care.
Hold on. Hold on. I have 3 more people. I'm going to make a statement and I want you to complete it, right? Laurentia, If the government does not provide for those 4 proposals, the nurses will do what? Complete it.
Hello.
Yeah. Can you complete my statement? If you
Please,
don't
the
get all your 4
statement
proposals,
again.
if you don't get all your 4 proposals from government, what would you as a nurse suggest GRMA to do?
The best decision for all nurses.
Which is no,
for all
what's your
nurses
personal
and
opinion?
midwives.
Yeah.
Yes, so the best
your boss is here.
decision.
What would, yeah.
My boss, we trust them and we have given them the mandate. So they can give us the best decision and we are ready to adhere to it at any time.
Thank you very much. Let's go to Isaac. I want you to complete my statement. If government or the administration does not come, meet you with your 4 proposals, nurses as nurses, what would you suggest you do?
Okay, thank you for the opportunity.
I want you to complete my statement. We have only 2 more minutes to go.
No,
Complete my statement. Yeah.
I have a reason. Before I can come to the answer.
Okay, go ahead. Make it brief because we have only 2 more minutes. Go ahead.
Yes. So I think in Ghana, the employer is making people have the perception that it's only strike that they listen to. And because of that, anytime we have such issues,
we've had a conversation. We say what? No, strike is the last resort. We are not at the last resort.
Yes,
strike is the last resort. And I'm asking you. Yeah, go ahead.
And that is what almost every employer believes, that government only listen to people who go on strike. So I am only trying to advise the ministry that once we are coming with a research agenda, these issues that we are handling, let's handle it differently, so that it doesn't mean that it's only strike that work for us.
Okay, all right. Thank you very much. Okay, thank you very much. Let's give the last person. Is it Natasha, right? Let's listen to Natasha, then go to Francisca, then we'll end the section. And Natasha, what do you have to? I want you to complete my statement. If government doesn't meet by meeting you with a 4 proposal, what would you do, Natasha?
Good evening. Thank you for the opportunity given. I am from Saboba in the northern region, and the members in Saboba and the northern region as well go back to the song our employer will understand. And I believe I'm speaking the mind of my people. Thank you.
All right, let's last person, Theophilus. Last person, Theophilus. All right, if you can hear Theophilus, we've spent almost like 3 hours. We want our panelists to have a closing remarks. So let's start with you, Esther, first. All right. Esther, what will be your closing remarks? Esther, can you hear me? What will be your closing remarks? All right.
Okay.
Let's go to Tony.
I would also want to put my voice. Yes. And we will want Mr. Tony to speak to our employers that have been put across by the nurses. Hello.
Yeah, I'm listening. Is it Esther? Esther, go ahead.
Yes. To try and then meet us at a...
Okay. All right.
Like I
let's
said
go
earlier
to
on, it is not on our interest to embark on any strike action.
Okay. Let's go to Dr. Tinkrine. Your closing remarks.
All right. Thank you very much for giving us this platform to articulate our concerns. I believe that we love our job. We're trained to offer care to the good people of Ghana and beyond. I mean, when Ebola broke out, we shipped Ghanaians to Sierra Leone, and they did a fantastic job. COVID-19, people were hiding under their beds. Nurses and midwives were the gallant people who ward off the infection. We think that that's what we are trained to do. Government should pay us well. They should respect that. They should factor us into any budget because we matter. And we will do what is expected of us. In fact, it saddens my heart that we have to come to this level. That is why we gave a very elastic roadmap to allow my brother, Tony Goodman, and the rest be able to do the needful, but they refused. Instead of that, they were looking at other things, thinking that they could be able to, use some draconian tactics to break our front, and it didn't work. And I think that we've all learned our lessons. We are ever ready to support the ministry to succeed. I have promised the minister, is a young man. We need to support him to succeed. We need to support the government of the day to succeed, so that all of us will benefit from whatever research agenda that they have brought, but not at the detriment of nurses and midwives. Thank you.
Thank you very much. Tony Goodman, right? Let's hear from you.
Yeah, thank you. Laurentia talked about the roadmap. Tim Crane has also talked about the roadmap. Red band means strike. So that issue about we give a roadmap, it was supposed to be long. Tim Crane, immediately you do red band, you start with red band. It means that you have started the strike action.
But we didn't leave post.
However, no, I'm just saying this one is we are all learning, but the red band it's part of the strike. So
the protest, strike.
No, it's not a process. It's part of a strike.
Okay, it's a closing remark.
Am I right?
Time is fast spent. It's 3 hours. You have 3 hours already. Please finish the strike. No, please allow him to finish.
Tomorrow morning,
it's 3 hours. We have other statement. So finish your closing remark.
So we've heard their demands. The reason why I decided not to talk about the negotiation or the discussion with the Parliamentary Select Committee and the nurses is because they are actually leading that process. It's not us. That is why I decided not to talk about it. But I hope by the time we are done with this, we all be okay. The nurses will be fine. Government will be okay. The Ministry of Finance and Ministry of Health will be okay, and then make sure that the people of this country receive the best care we promise them. That is our mandate, and we are sure we'll do that. Thank you.
Thank you very. Let's listen to you, Dr. Nsiah-Ansari. Your closing remarks on what we have discussed so far in terms of moving forward and the 4 proposals that has been tabled.
Yeah, thank you very much, Ben, for putting this wonderful thing together. And what I would say is that the deadline has been given as 6 days from today. What I hope should happen is that the negotiation should continue for the 4 things that they've put on, proposals that they've put on the table. I don't want us to wait till 26. I'm hoping that today is 21st, isn't it? Or 20th. I'm hoping that maybe by Monday morning or so, various teams should come together and tell the whole country that we have sorted it out. Then everybody will have his peace of mind. I also will plead of my nurses and midwives that this is negotiation. So sit down, do the jaw, and make sure that when 2 elephants fight, is the grass which suffers, that the grass doesn't suffer. And I'm very hopeful that something very meaningful will come out of this. But please, Tony, sit down as early as possible. Don't wait till the night or the night before 26. And we want to hear something very positive from all of you. Thank you.
All right, before I come to Mr. Ostigame, Tinkra, this is my last one. You know what I'll be able to do with this. So I've been talking for some time back. I can tell you that the Minister of Health was at the Jubilee House on Wednesday or Thursday. So there's some sort of negotiation going forward. So we are hoping that what you've tabled will be done, but anything can happen. So Mr. Ostigame, you are the final word. Then we'll call it.
Grateful. Thank you for the opportunity and holding all of us hostage. I don't know whether yours too was a small strike. You held us hostage for 3 solid hours. We are grateful to you. A lot of things have been said. I think we've all learned lessons. And I pray that the nurses' leadership would truly provide that leadership for the sake of their customers. And the employer, Tony, please, I'm aware that meetings are being held. I've also been trying to follow what's going on. Nonetheless, let the minister be aware of the sentiments expressed by our colleagues from the nursing fraternity. I wish them well, but strike should be put at abeyance. We should not revisit it again. Let's do everything we can to resolve the matter.
Thank you very much. So on this note, we come to the end of another Sankofa African review coming from Mediating.
Tony, we need your phone number.
We hope that we'll be able to come back. We hope that we'll be
You
able
want
to
to
have
come and
another
beat me in the house,
section on this thing about the way forward, whether the whole thing has been resolved. So we will be looking quietly and patiently, and whatever we can help. Those of us in the diaspora who have the networks and will be able to engage, we'll try as much as possible to get involved to have this issue resolved. And we, like I said, we are advocating for the nurses for a peaceful resolution to this. We know they demand the best. Me coming from the US, I know the way the system works.
Please, some of us didn't get the 4 conditions of service, so the one is being tabled. We beg.
Yeah.
Don't worry.
Let me tell you, I spoke to Tinkra. I almost died when I went to do my national service somewhere. So I understand some of these dynamics. It was the nurses who saved my life. So I'm an advocate for the nurses, but at the same time, I'm being realistically objective about things. So on this note, we hope to see you again after whatever is being tabled has been resolved. So on this note, I say, enjoy the rest of your day.
Thank you. Thank you.
Thank you very much. When you get the opportunity,
You are trying to say anything. You want to know what is there.
Tony, remember we are not entertaining.
Yeah, thank you very much. Thank you very, very, very.